Check. Mental health is a destination. Mental health is not a destination, but a process. It's about how you drive and not where you're going. With that being said, good morning, ladies and gentlemen, distinguished guests, speakers, and attendees. It is with great pleasure that I welcome you all to the National Mental Health Seminar and Foundation Day, dedicated to advancing the dialogue on mental health and celebrating our achievements. I am Yashpreet Kaur.
And I am Bhavna Sharma.
We are your MCs for today's event, and we are extremely honored to guide you all through this impactful gathering. Please welcome.
Mental health is a crucial aspect of our overall well-being, yet it often doesn't receive the attention it truly deserves. Today we are gathered here to change that. Our goal is to provide you with valuable insights, tools, and resources to help you better understand and manage the mental health, both for yourselves and for those around you.
We have a fantastic lineup of speakers who are experts in their fields. They'll be sharing their knowledge, personal experience, and practical strategies to help us navigate through the complexities of mental health. Each session today will offer unique perspectives, so I encourage each one of you present here to engage actively, ask questions, and take full advantage of this opportunity to learn and grow. Let's remember that the seminar is a safe space and a supportive space. Well, thank you again for being here and for taking a proactive step towards better mental health. Now, without any further ado, ladies and gentlemen, let's get started with our first speaker.
It is my privilege to introduce our keynote speaker for today, Dr. Kiran Kumar, a psychiatrist at Vaidehi Institute of Medical Science and Research Center. We welcome you, sir. Good morning, sir. Good morning, sir. Welcome. I also request Dr. Lingraju ji to present the bouquet to Dr. Kiran. Dr. Kiran, may we please request you to share your insights with us, please? Thank you.
Thank you all. At the outset, it's my proud privilege to interact with young minds. It's always wonderful to interact with young minds. I take this opportunity to thank TREDA for giving this platform to share some insights about mental health. One minute. Moving. It's not changing. These are my credentials. I practice at Vaidehi Institute of Medical Sciences and Research Center, Bangalore. It's a 1,600-bedded medical college hospital, and I represent the Department of Psychiatry as professor and HOD. And these are my credentials. Next. So every time I speak, I take a forum, I wear different hats. I'm a clinician, I'm an academician, I'm a researcher. Next. So today I thought, what kind of an hat will I wear? Particularly when I'm addressing young minds like you, I thought, let me wear the hat of a mental health professional. I'll be a mental health educator to you today. I request you all to clarify any kind of doubts you have. What I'll do in the next 30 minutes or so is to take you to the nuances of mental health. How do we understand what is mind? What do we do to understand what is mind? And what can be done to understand the intricacies of mind and its disorders, particularly in young population. So today, I thought let me address mental health and youth, particularly among college students. I see there are few nursing students. I see students from different backgrounds over here. So let us see how mental health is important in a changing landscape. Next slide, please. We know that India is the most populous country as of today. I think it has surpassed China. Officially, we have a population of more than 1.4 billion today. The most important thing among that is 65% of our population is under the age of 35 years. So it's an young country that we are representing. In that, about 400 million of us belong to the age group of 10 to 24 years, and that is what the crowd represents today. That's an important population. If you look at this slide, when we compare the slide of India and China, we see a classical pyramid which is represented, the base is represented heavily by the young population, whereas in the China, we see that there is distribution. So China is aging, whereas we are an young population. So it's absolutely important for us to address this young population. The health of this young population is extremely important. The way WHO defines health is a state of complete physical, mental, social well-being, and not merely by the absence of disease or infirmity. Now this is an over-encompassing definition. But unfortunately, the emphasis on mental health is alienated. It is alienated at all levels today, at the level of the individual, the level of the caretaker, the level of the family, the level of society, policymakers, lawmakers, etc. So the whole concept of mental, the so-called in inverted commas, is distorted. Please understand what is psychological or what is mental. The way we understand physical disorder, whenever there is a, next slide, whenever there is, the body gets affected, we call it as a physical disorder. The mind gets affected, we call it as a psychological disorder. The problem is to understand what is mind. The way we understand mind technically is cognition, conation, and affect. Next slide. Or the way we think, act, and feel. Okay, so simply, what is mind? Next slide, please. The way we think, the way we act, the way we feel. Okay, and this happens in all our daily routines. Now, if these are the three cardinal functioning of the mind, where is the mind located? The organ of interest for anybody with neuroscience background, for a neurologist, psychiatrist, for a neurosurgeon, or anybody from neuroscience background is the brain. So today when I say mind, the seat of mind is brain, and we are talking about disorders of brain itself, and nothing is in thin air. It's concrete disorders of brain that we are talking about today. The decade 1991 to 2000 was called as the decade of the brain. The way we understand brain today is in real time. We see the brain in real time in various aspects into neurophysiology, neuroanatomy, neurogenetics. It goes on and on. And today we are no more in the era of structural imaging. The way we see brain is functional imaging. We see brain in real time. These are SPECT and PECT images of a person who's treated for depression. We can see some pictures on how a depressed brain looks and how after treatment what happens to the brain. The whole idea is to convey to your people that today we are no more in the era where something is in thin air and we don't know what is happening. It is very concrete. We see brain in real time. We see disorders of brain in real time. So in that context, it is very important for you to understand why are we talking about brain, why are we talking about disorders of brain, why are we talking about mental disorders today, particularly for a very, very important part of the population, the youth. So that we can only understand when we understand what is the magnitude of psychiatric disorders. So according to WHO, about 450 million people worldwide suffer from some kind of neuropsychiatric disorders. Now probably you will not be able to conceptualize what is this 450 million. To make it simpler, we have about 1 in 4 of us will have a diagnosable, treatable neuropsychiatric disorder in our lifetime. So you can just imagine the magnitude now. There are few myths about psychiatric disorders, that psychiatric disorders occurs at some point of time, why should it occur to children, why should it occur to young population, we are healthy, we don't have any problems, etc. But if you look at the statistics, and these are global statistics, universal statistics, we see that around 1 in 5 of our children and adolescents will have some psychiatric disorders, and more than that, about half of mental disorders occurs before the age of 14. So by the age of 14, you already have a mental disorder. Okay. So that's what we are talking about. That's the emphasis on psychiatric disorders in children. Most of us think that psychiatric disorders leads only to morbidity. But why will they die because of psychiatric disorders? We know that people with severe psychiatric disorders die about 10 to 20 years earlier than the general population. So severe psychiatric disorders not only lead to morbidity, they also lead to mortality because of various reasons. What about the cost factor? The global economy loses about 1.4 trillion US dollars only because of illnesses such as depression and anxiety, which is the most common psychiatric disorders. We are not talking about the rest. The other important concept that is very, very important for today's discussion is suicide. People think that let us not talk about suicide, why should we introduce this concept for an adolescent or an young adult? But we as mental health professionals are very clear that this is a topic that has to be addressed in the open forum. Suicide is one of the leading cause of death. About 8 million suicides occurs every year. That is about one death every 40 seconds. By the time I finish my lecture, there will be so many of them who would have completed and died because of suicide. The most important thing about suicide is for every one suicide, there are about 20 to 25 suicide attempters. Okay. So these are huge numbers that we are talking about. And the whole tragedy is suicide is the second leading cause of death in individuals aged 15 to 29 years. Now, unfortunately, that's the age group that I'm addressing today. It brings pain to me because when I say this is the second most commonest cause of death in young adults, the common question that has been asked to me is, what is the most commonest cause then? The commonest cause in this age group is road traffic accidents. So the tragedy is we are losing youths to two preventable causes of death, be it road traffic accidents or suicide. And suicidology is my area of specialty. So it is a preventable specialty. So we have to address suicides. We'll go back and readdress suicide, why it happens, what are the factors little bit later, but it is a very important determinant of mental health outcomes. So by this, you all know that the metaphorical expression, the magnitude is an elephant in this room. The magnitude is extremely huge. It is very, very common. It occurs everywhere, be it your friends, be it your neighbors, be it yourself. It can strike anybody, anywhere, irrespective of age, gender, population. Much more common in the young age group that we are talking about. So please understand, mind and body is not a dualistic concept anymore. It's an unitary concept. The way we divide mind, body, neurologists, psychiatrists, cardiologists, etc. are arbitrary. They are not watertight compartments. It's an unitary concept. Okay? It's a neurobiological construct. In that background, let us understand about mental health and college students. Here are a few questions that I would like to ask you, and probably you can answer at your own levels. Okay. Say yes or no to these questions. So answer the following questions. Too many things to handle. There are a lot of things in academic sphere, personal sphere, professional sphere, interpersonal sphere. Constant deadlines for all of you. All tasks are priority one. Everything is priority one. Nothing is priority two. There is no me time at all. Though we are surrounded by gadgets, we stay in a virtual world, but there is no me time at all. Efforts often seem nothing, don't get satisfying results at all. Only I have work. My friends are all enjoying. That's what we think a lot of times. Change in environment, relationship, romantic relationship, parents, sisters, etc. Reluctant to ask for help. There is help available, but somehow the art of asking for help does not exist. Trouble saying no. We take a lot of things onto your plate from all the spheres. It becomes very difficult for us to say no. If a majority of the questions are answered as yes, then welcome, probably you are in the right place to understand what is this going to lead to kind of thing. So there are a lot of academic factors among students. There are a lot of physical factors, social factors, emotional factors. All these things leads to a concept of stress. So the first and foremost thing that we'll be talking today is stress. From there we go to something called distress. From distress probably we go into the concept of disorder. Now the concept of stress is something that as professionals we have always addressed it, and not only as professionals, today in the new world, there is the next slide, even the media has started recognizing that crisis of stress, mental health among students, among college students, students in campuses is enormous. So in that concept, let us understand what can stress lead to. Next slide. So stress and mental health is becoming extremely important in a changing world. Now, why do I call it as a changing world? Mental health in the changing world was a theme of world mental health, mental disorder, world health disorder that we, mental health day that we conduct on October 10th every year. This was one of the theme a couple of years back. Now let us try to understand why we are talking about a changing world. The world is getting polarized more and more today. That is adding to enormous stress to the students amongst the stress that I have already discussed. Particularly, pandemic showed that the stress is extremely important and the world has become really polarized. Now, why is it got polarized? We are talking about race and ethnicity. We are a multilingualistic country. Every college, every campus are representative of the whole of the country that we are in. So when we talk about local issues, there are a lot of local issues. There are issues related to race, ethnicity. When you look at global issues, if you go back to the world where the world has become a small village, when you go to other universities' campuses, race and ethnic issues are extremely common. Racial and ethnic minorities particularly have a greater burden of mental health needs and thus suffer greater loss to their overall health and productivity. So this is one area. Please note, we will not go into the details. I'm trying to emphasize what is this changing world that we are talking about, and each one of us will have an array of these issues that leads to stress. Gender roles, we always have that some gender roles, masculine roles, feminine roles, even mental health disorders have been genderized. If it is depression, then it should be in males. If it is anxiety, it should be in females. If it is substance use, it should be in males. But unfortunately, we know that it is not true, and gender roles that we have been identifying from time immemorial are becoming a little bit difficult to understand as of today. So are gender identities. We know that today we are in a world where gender identity is fluid. The concept of male, female does not exist anymore, and we have a whole spectrum in between, and each student have their own preferences. It leads to a lot of psychological, emotional issues in them. Orientation is one more issue that we are talking about, LGBTQ committee. We are becoming extremely aware of the psychological issues of this community. Many of us probably in this room will have a lot of fluidity in these areas which has to be addressed, which leads to a lot of stress and discomfort. We also talk about human rights, and we know that though we are students, a lot of basic human rights are being violated. Recently, I think you are aware of a lot of issues going on in a medical college in Kolkata and the kind of human rights issues that we have been facing as students. So these are extremely important, leads to enormous amount of stress. So the question of human rights sometimes does not exist. Since we are a multi-dimensional country, I'm also talking about social factors today. We have enormous poverty, and the rich and poor divide that we are having is becoming very unequal in this changing world, again leading to enormous stress among the student population. The other important concept is the virtual world that we are living in. Yes, pandemic accentuated this virtual world that we are living in, and today, though human being is called as a social animal, we are no more social. We spend about 10 billion hours using social platforms each day. It accounts to about 1.2 million years of human existence. That's the amount of time we are spending on probably the social media. So today, we are no more social animal, we have become virtual animals. Okay. This has led to enormous interpersonal issues, issues with coping, poor social support. Was a family support, was a joint family system which is getting dwindled into nuclear families, now into virtual families, leading to a lot of distress, particularly among young students. So a lot of these external and internal factors leads to stress, and the outcome of stress we all know can be in different domains. It can be physiological or bodily symptoms, cognitive, thinking sphere, behavioral symptoms, emotional symptoms. We'll just see what are the symptoms of stress, particularly in young students. Physical, multiple aches, body aches, emotional irritability, short temper, feeling fearful, sense of isolation, cognitive. A lot of students say, I cannot concentrate, I forget, I cannot memorize. Poor, we have a gamut of symptoms. When there is stress, it leads to distress, and occasionally it leads to disorder. About 10% of them with stress can go into a stage of disorder. Today we will just touch upon what is this distress and what is this disorder. The most common distress symptom that we have is burnout, extremely common among students, followed by substance use disorder, and occasionally the tip of the iceberg, few vulnerable students can develop psych disorders. It can be common psychiatric disorders or common mental disorders, or very occasionally severe psychiatric disorders in a vulnerable population. This is the concept of burnout. Most of you probably would have experienced it. Suddenly you feel your energy is getting depleted, you are not interested to do any daily chores, daily activities, and you have reduced professional efficacy. This is because of chronic stress. The resilience is like a rubber band going to probably elastic limit of the rubber band is going to break at one point of time. Burnout is before it starts breaking. Substance use, I would like to emphasize, even now when we were sitting and discussing, we were talking about the common abuse of substances. Substances have become very, very affordable, it is available, and youth start probably experimenting it for different reasons. The relationship between stress and substance use disorders is bidirectional. Substance use disorders leads to stress, substance use which can be an outcome of stress, or stress can lead to substance use, whatever is the phenomenon, can have a lot of mental health repercussions. And this has been covered in the media time and again, that substance use are a big no. They cannot be used as substances of coping for any reason. It leads to maladaptive behavior and the outcomes are dreaded. Occasionally, few people can have frank psychiatric disorders, as I told you. Psychiatric disorders can be minor or major, and it's a spectrum. At one end, we have very mild symptoms, sleeplessness, eating problems, to depression, to severe disorders, to substance use disorders, to suicides. So it can be a spectrum of mental health conditions that can be seen. Please note, not every one of us with stress will land up in a disorder. Not every one of us stress will have a distress. There need to be a vulnerability. Now this is what we explain by something called as a 4P model. This is called as a stress diathesis. So there should be a precipitating factor, like somebody failed in the examination and then I say they got into depression, he committed suicide. But not everybody who failed in the examination went on to have a depression, because the person should have a predisposition. The predisposition can be all the factors that I spoke to you about, the changing world. There can be some genetic factors, and there can be certain perpetuating factors in the family. Okay, there can be family background, alcoholism in the family, broken families, etc. lead to perpetuation. As I told you, not everybody with these factors develop a disorder. Lot of us have protective factors, and as youths we have to develop protective factors. That's what my next speaker, Dr. Johnson, will be talking about, positive mental health and how to foster these protective factors. So there need not be the precipitating factor that actually made the illness. It's the predisposition and the perpetuating factor that pushes you to a psychiatric disorder that has to be addressed in our routine. Along with that, we know that it's not so simple when I talk about psychiatric disorders today, because there are n number of factors. There are academic factors, personal factors, factors that started from your birth. And in the background, there is a huge biopsychosocial model. There are a lot of biological factors, social factors, and psychological factors that pushes an individual towards a stage of psychiatric disorder. It's quite complex, but it can be handled. Okay. Lot of students ask me a common question. When does a symptom become a disorder? I'm feeling sad. Do you mean that I'm depressed? I'm feeling anxious. Does it mean that I have an anxiety disorder? No. Whenever a symptom is predominant, when the symptoms is occurring throughout the day, it is persistent, it is there every time, it is pervasive, irrespective whether you're in college, whether you're in a house, whether you're with your friends. If these symptoms are persistent, pervasive and predominant, then is when we probably say there is a psychiatric disorder. So it should be persistent, it should be predominant, and it should be pervasive. So a couple of slides on what is the outcome and what are the common psychiatric disorders that we talk about. Common mental health issues that you need to recognize, why I'm naming them is so that we understand these are disorders. When I say disorder, I'm trying to blame the illness rather than the individual or the person. Anger, irritability issue at a symptom level are extremely common in young adults. Substance abuse, any substance, we are talking about licit or illicit substances which are easily available. Suicide, as I told you, please note, if somebody is talking about suicide, be it your friends, be it your colleague, be it your family member, one thing that you can do is talk to them. Try to understand what led to that, what are their thoughts, have they acted upon it, are they planning about it. So just talking to them at your level, trying to address it and probably referring it to a counselor or a mental health professional is going to solve problems in a lot of cases. Sleep disturbances are very, very common because we stay in a virtual world, we have enormous stress and there is no time for sleep at all. Eating disorders, particularly among young women, is again extremely important, either in the form of excessive eating, excessive concern about the way you look. And adult ADHD, again a common thing, because if you Google, you say that you are inattentive, you are impulsive, you cannot control your impulsivity. Symptoms of adult ADHD which can impair your academic performance. There are other things, major mental illnesses, which we will not talk about today. The worry is, what are the consequences of these common mental disorders in your life? So the outcomes, it's quite general knowledge or common sense to understand what are the outcomes if you have a disorder which is going on and on. There is distress, there is poor social performance, there is poor quality of life, substance addiction and behavioral addictions as an outcome, suicide as an outcome, and very, very important young population today. The question is, we understood the magnitude is very high, it is very, very common. There can be a spectrum of psychiatric disorders in youth. The question is, so what? Please note, there are about less than 10,000 psychiatrists in India as of today. These are numbers because we have something called Indian Psychiatric Society, which is a registered body. Less than about 2,000 clinical psychologists, very few psychiatric nurses, and India spends a meager 0.606% of its health budget on mental health. Okay. So these are absolutely pathetic numbers. According to some media reports, India is short of about 60,000 psychiatrists to meet the global standards as of today. So in that context, we are talking about two elephants in this room. There is a huge magnitude and there is dearth of mental health professionals to address these needs, which are very, very common in young youth. So what should we do? What should all? So it's time that we all join hands. It cannot be done by one mental health professional where there is acute dearth of them. So it's for all of us to join hands, make us understand that there is no health without mental health. Mental health is extremely important. Identifying, accepting that there is a mental health issue, trying to balance out mental health issues and see how it can be controlled is the need of the hour. So with that, I would like to end my presentation and I would like to hand over it to the next speaker. Thank you very much. Any questions?
Thank you so much, Dr. Kiran, for such a wonderful insight, full of mental health, the statistics, the illness, and above all, that big picture which speaks for itself. The brain, how it is when someone is without depression and with depression. Thank you so much, sir. Also, if anyone has questions, we are more than happy to take it. Or towards the end of the session, we can also do that. Does anyone have any questions? Dr. Kiran is more than happy to take them.
Good morning, sir. Thank you for a wonderful session where we have BSc Clinical Psychology being introduced, and there's going to be only a limit of 30 students or so, if I'm not wrong. So we already have a lack of clinical psychologists in this country. So how are we supposed to move towards encouraging more students to join clinical psychology if the criteria just keep getting more stringent and there's no clear path for that? So
See, we know that there is a huge magnitude. There is a requirement. Address it is by capacity building. Now, capacity building is coming up with new resources. Okay. Once we make them understand that it is extremely important, and there will be a lot of opportunities in future at different levels, at the level of schools, colleges, occupational psychologists, clinical psychologists, etc. More and more people will probably take it up, and it is going to benefit the society at the end of the day.
thank you.
Thank you.
Thank you, Dr. Kiran. Thank you for your question. Any more questions? We will also have a brief question and answer session towards the end of the speaking session. So please write down if you have any notepads and pens, and we can take your questions later. Thank you. Thank you, Dr. Kiran, once again. Please join me in welcoming Dr. Johnson Pradeep, our Head Department of Psychiatry, St. John's Medical College, who will be presenting us on the topic of positive mental health. We welcome you, sir.
Good morning. Good morning. I think none of you have had breakfast. Little more louder. I think you have to break the ice. Please, all of you stand up. Keep all your books down. Get up, all of you fast. Yeah, take a turn, right side, around. Yeah, come on. All of you move. Move around one full circle and then sit. Yeah. Yeah. We'll play a small game, okay? Okay. So again, let's play a game. All of you stand up. Keep your books down. According to the latest health guidelines, you are not supposed to sit more than 30 minutes continuously. Please remember that, and any opportunity you get, please get up and walk. Okay? Now, let's see how attentive you people are. I think when Dr. Kiran was speaking, a lot of noise was there. Then there's no point in having this seminar. Okay? So when I say sit, all of you, sit, stand, stand. Okay, very good. I'm very happy all of you are attentive. Please sit.
Thank you so much, all our attentive students. We really appreciate it. Now I'll request Dr. Lingraju ji to present a bouquet for Dr. Johnson, please. Thank you.
I think my friend Dr. Kiran gave you a background why it's important to think about mental health. So do you all think after listening to the talk by Dr. Kiran, mental health is important? Is there anybody who disagrees? Who feels, no, I'm fine, mental health? Is there anybody who feels that? If you have, please. Yeah, recently we had a Catholic conference on mental health ministry this year. Bishop Peter Machado gave his keynote speech. You know what he said? Everybody has a streak of madness. Do you agree with that? So if everybody has a streak of madness, then everybody is mentally ill, no? Isn't it? If you have a streak of madness, we are all mentally ill then. Everybody is mentally ill then, is it? Do you agree with me? So what he meant was, there is madness in all of us in the form of creativity, in the form of intelligence, in the form of certain skills. That's what he meant. Okay? So there is creativity, there is some level of madness in us that makes us more creative. Okay. Now, can you go to the next slide? In fact, WHO has given a definition of health. So I think you all know, everybody is working in the mental field will know about this WHO definition, that health is a state of complete physical, mental and social well-being, and not merely the absence of a disease or infirmity. That means you may be physically fine, you may be socially very good, but if you're not mentally fine, you have a problem. Okay? So it's very important to keep your mental health so that you can continue to function normally. Okay? So please remember, when we say mental health, it doesn't only involve disorders. We talk about mental, there are a lot of things like positive mental health, okay, resilience, which we'll be briefly covering about every stage. So it is an umbrella term. When you say mental health, it's like an umbrella term. Okay? There are a lot of factors or lot of mental related issues in it. Okay? So it's very important to tease out what is normal, what is abnormal. Okay? So as psychiatrists like Dr. Kiran and myself, we deal with a lot of abnormal psychology, like psychiatric disorders. We deal with schizophrenia, we deal with depression, suicide, bipolar disorder. So not only that, we have seen even normal people coming to us and taking help. Okay? So many times we have difficulty distinguish whether it's normal, abnormal. Okay? Sometimes there's a thin line between that. So it's very difficult sometimes to do that. Okay? So that is where the role of a team comes in. We have a team of doctors, clinical psychologists, you need a psychiatric social worker, a psychiatric nurse, who actually form and they evaluate patients and give you a lot more information. Next slide. So mental health is a big umbrella. Under that there are so many things you can see here. Okay? Next slide. Okay. Now Dr. Kiran has actually covered on what are the difficulties a college student can have, what kind of mental health issues you can have. You can have depression, you can have stress, you can have burnout, you can have even psychiatric disorders. So just raise your hand if you're happy taking up your profession, whatever profession you are. Just raise your hand. It could be a nurse, it could be a psychologist, it could be any other psychiatric social work. Nobody has forced you, but you have taken a decision that I will do this profession. All of you raise your hand. So on top, nobody is there? Yeah. So many of them, yeah, please put it down. If you look at even medical colleges, engineering, a lot of other fields, many people are pushed into the profession. They are not interested. They are not interested in becoming doctor, nurse, psychologist, or an engineer. Many times because of peer pressure, many times because your family, somebody is a doctor, they are pushed into it. Okay? So many times they are not happy with the profession what they take. So that can lead to a lot of stress. Many people go into depression. Many people even make an attempt to commit suicide. Okay? So it's very important to know how, despite whatever you have chosen, whatever field you have chosen, how you can keep your mental health fit. Okay? So you can keep your mental health fit. I know we have a lot of vulnerabilities. Many people have already pre-existing family history, psychiatric disorders, but still to some extent we can keep our mental health at well. Okay? So first part is taking care of your health and well-being. So what do I mean by that? How many of you walk every day for at least 45 minutes? How many of you walk every day for 45 minutes? How many of you cycle? How many of you have some time for yourself? The me time which Dr. Kiran was talking about. See the proportion, very few. Okay, we are so preoccupied with our life. You're preoccupied about your work. We never think about yourself. So very important is taking care of yourself first. If you're not going to take care of yourself, you will die early. There's nothing to do about it. You cannot crib, oh, I've developed cardiac problem, I've developed hypertension, I've developed diabetes. First, take care of your health. If you take care of your health, your mind is also going to be fine, okay? And you will live longer and you will have a happy life, okay? So that is the first point. The next point we'll go into. Managing time effectively. How many of you actually can manage time effectively? Yeah, can you say one or two tips on how to manage time effectively? Yeah, yourself. Please use the mic. Yeah. Okay, sure. So as students, you may feel, oh, I have 9 to 5 classes. I cannot do anything about that, but you have lot of time after that. You can get up early in the morning and go for exercise. The evening, you can actually plan it properly. I've seen many students actually studying the whole night. They sleep at 1 o'clock, 2 o'clock, or sometimes 3 o'clock or 4 o'clock because they want to study well for their exams. In the cost or at the cost of their own sleep, and they're going to sleep in the class next day. Okay? So, unless and until you plan your day properly, you're not going to do well. So the first point, can you tell me what is the first point I talked about today? The first point, taking care of your health and well-being. Second point, managing time effectively. So you can actually put up a timetable, okay? See, everything may not go on as you plan. Every day may be different, but at least you can stick on to what you're planned for. Okay, always have a timetable, at least for a week. So don't make it for 1 month, 2 months, it's going to be, superfluous, So just make it for 1 week, and make sure you're going to cover these subjects. I'm going to do this work priority-wise. As she said, prioritize your work. Everything is important, I agree, but everything will have some deadlines. So work according to the timelines, and you need to have time for yourself. Nowadays, many people are addicted to mobile phones, the screen time. Actually, they spend more time on screen than themselves. Okay? Social media, they keep watching WhatsApp, mobile, waste lot of time actually. Lot of time goes waste in that. Okay? So, managing your time effectively can actually help you a lot way. Okay? In fact, in US, lot more students actually go work also. Out of their study time, in the evenings, they go work in bars, parlors, whatever options are there, but they are able to manage their time effectively. So what I'm trying to say is, in a day, we have at least 12 hours. You can definitely plan according to that. Okay? And please remember, sleep is very, very important. Don't compromise on sleep. Okay? In my Saturday OPD, I get a lot of clients, especially from IT companies. You know why they come? Because they have sleep problems. They work the whole night and they sleep in the morning. Okay? So you are reversing what God has created for us. Okay? So it's very important that we work according to the nature. The moment you go against nature, you start getting all the problems. So it's very important to sleep well. Okay? That's a very, very important thing. At least as young people like you should be sleeping at least 8 hours. Okay? Do you think sleep is important? Why is it important? Why is it important? Just because you get rest, that's all? There are a lot of things happening during sleep. Okay? In fact, your memory is becoming more strengthened. Whatever you have learned that day, from short-term memory, it goes to the long-term memory. It happens only during the sleep. Similarly, lot of body functions are getting normalized. All the wear and tears of the day gets normalized during the sleep. So sleep is a healthy process. It's very important we do that. Next slide. So third very important point is recognizing your strength and limitations. So do you think all of you are unique? Is there anybody feels you're not unique? So you all feel that you're unique, isn't it? So all of you are talented. You're all born with certain talents. Recognize that. Okay? Recognize the values you have. Recognize what good things or creativity you can have or what you have. Or sometimes you can develop some new creativity. Okay? So recognizing that is very important. Okay? That is why spending me time is very important to know all these things. So unless you can take the help of a psychologist to understand yourself. Okay? So understanding what are the positive things I have. Okay? These are your actual resilience. They actually help when you have a problem. Sometimes some people are very good in handling problems, or sometimes some people are very good in negotiating certain things. Some people are very good in talking. Some people are very good in writing. Some people write poems. Some people write a good story. So each one has a good talent. So utilize that. Okay? So very important is to first recognize, and there's nothing wrong in developing a new habit or a new hobby which you like. So that helps you a long way. Okay? Not only that, please remember we all have limitations also. Okay? So everybody will have limitations, but doesn't mean that there's nothing going forward in that. There is definitely understanding that we'll know that what are you good at, what are the weaknesses you have. You can work on that. Sure. So it's very important to understand what are the positives I have, what are the negatives I have. So use the positives, and if possible, you can work on your negatives also. Okay? Is it right? Okay. Next. Surround yourself with good people. Maybe I'm a little moralistic here. Do you think that is good? Many of my patients who come with substance use say, "Doctor, I don't want to drink, my friends forced me." So I always ask them, were you sitting quietly when they poured alcohol into your mouth? Is it possible? So unless you drink alcohol, others will not give it to you. So surround yourself with good people. What we mean by good people is those who don't take substances, those friends or peers who are there for you when you have a problem. Okay? Those who are supportive when you have times of loneliness or when you have some issues, they are there to help you. Those are the people whom you need at times, and at the same time you should reciprocate that also. So surrounding yourself with good people will help you a lot. The relationship or the bond you're going to have with them is really going to last a long time. So surrounding yourself is very, very important with good people. Okay? Many times, many young people, students come and tell me what are the kind of problems they go through, how they are influenced into drugs of abuse, how the whole life has, the trajectory of their life has changed into some other problems. They get into gang wars, they commit small mistakes and they get into the prison and their whole life changes. So having good friends, peers, associating with people who are more productive actually will help you also to be motivated to do a lot of good things. Okay? Next. Practice relaxation. How many of you practice at least 10 to 15 minutes of relaxation every day? How many of you? Please raise your hand. Please raise your hand. How many of you do that? So none of you are doing that. So that time you'll be watching your mobile. Okay. Now let's do one small exercise. Okay. Now keep all your bags, books, everything down. Okay. We'll do a small relaxation session. This is called box breathing. Okay, anybody can do any point of time except if you are having a major psychiatric illness, you are not advised to do this. Okay? So, all of you just listen to me once and then we will do the session. So, this box breathing, okay, what you have to do, first, it consists of a box. First is inhalation through your nose, 4 seconds. Slowly you have to do that. Then hold it for 4 seconds. Then release it through your mouth for 4 seconds. Then you wait for 4 seconds. Clear? It's a cycle, you keep on doing that. Okay? So I'll give you the instructions. Okay? All of you can do it. Okay? Now all of you close your eyes. There should not be any sound backside. All of you close your eyes, keep all your books, all the other stuffs down, mobile phones off. Okay, ready? Now take a deep breath and hold it. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Release through your mouth. 1, 2, 3, 4. Wait for 4 seconds. 1, 2, 3, 4. Now inhale slowly. Your abdomen should be full. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Now slowly exhale through your mouth. 1, 2, 3, 4. Wait. 1, 2, 3, 4. Slowly inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Slowly exhale through your mouth. 1, 2, 3, 4. Wait. 1, 2, 3, 4. Slowly inhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Slowly release through your mouth. 1, 2, 3, 4. Slowly open your eyes. Yeah. So how do you feel? Isn't it simple? This is what we teach our patients also. Very simple. It's called box technique. Anybody can do it. You don't have to be a psychologist for this. It's a very simple technique of breathing, relaxation. Okay? It's a very simple technique. Anybody can do. You can teach others also, especially when you have a lot of stress, when you are very anxious. Please use this technique. Is it really helpful? Yes. Okay. Next. Next slide, please. Next slide. Okay. So I think Dr. Kiran also talked to you about drugs. Okay. Can anybody tell me, just rattle out what are the drugs you know? What are the drugs? Marijuana, very good. Alcohol. I can't hear, so if you can raise your hand and tell me also, it will be great. Any other? So marijuana, alcohols, cigarettes, tobacco, chewing tobacco, anything else? I can't hear you. Just raise your hand and tell me, shout. Painkillers. Dr. Roger is saying painkillers. He is seeing a lot of patients who abuse painkillers. That's also painkillers. Very specifically, we are talking about opioids. Opioids, no, they can cause addiction, no, especially cough syrup. Okay, what does cough syrup contain? Codeine. So that is naturally occurring opioids. So again, that is very addictive. Okay, any other? Any other you come across? I can't hear. Loudly. Cocaine, very good. Cocaine is there. Heroin, yeah, very good. Heroin again comes under the naturally occurring opioids, very good. What about petrol? You think petrol can be abused? Yes. Yeah, so sniffing. No, a lot of people do sniff lot of this kerosene or petrol. Some people even use RSX, okay, cleaning agents, perfumes. They all come under the category of inhalants. Okay, so there are many drugs of abuse. Even people are becoming more cleverer. Okay, have you heard of synthetic cannabinoids? Okay, so which cannot be detected in urine. Actually, most of the other drugs, no, we can actually detect it in the urine. But people are becoming more and more clever. Okay, so if you go to some parts of the country, you will get synthetic opioids. Like, have you heard of MDMA? Yeah. So PCP, MDMA, there are so many drugs of abuse are there. And different ways people are creative in taking it also. There are different techniques. For example, there's a technique called, I think you all know, our old grandmas used to take, no? They sniff tobacco, okay? So tobacco can be taken orally, smoked, or even taken intranasally, okay? So there are different ways people take this. You should be aware of it. I'm not telling you, please go do it, but you should be aware of it. When another person is taking, you should tell them not to do that, okay? So there are a lot of drugs of abuse, and the sad part is our youngsters are addicted to that, okay? They feel they are locked into it and they are not able to come out of it, okay? That is why we have rehabilitation centers, we have de-addiction centers now, which can actually help you to come out of that, okay? So what about coffee? Is coffee an addictive agent? So none of you are drinking coffee then? So what I'm trying to say is anything which is taken at normal levels, which does not harm your body, which does not harm your day-to-day functioning, is okay, except coffee and tea, okay? That doesn't cause that much major problems. Like, it doesn't cause you withdrawal. It causes to a minor extent, but compared to alcohol, tobacco, your cannabis, your opioids, they're very dangerous. No, you will get addicted to that, and you will get into problems. What does WHO say about addiction? So, is everybody who takes alcohol addicted to it or dependent to it? No. There are only some people, as Dr. Kiran was saying. Do you know how many crores of people are addicted to alcohol in India? 2.7 crores. 2.7 crores of people are addicted to alcohol. But around 16 crore people do take alcohol. So you can see that difference. No, so many people take alcohol, but not all are addicted. So what it says is that anyone who takes alcohol is not an addict. But if he continues to take it, his body is getting affected because of his intake. There are withdrawal symptoms because of that particular drug. He is not able to function his day-to-day activity, then it is a problem. Okay? So recognizing that, telling your friends, please don't take alcohol, especially in parties. And as young people know, they will say, oh, take little, nothing will happen. Experiment. You want to experiment. There's nothing harm in experimenting, but as long as it stops there. Okay? Don't go beyond that. It's going to cause a lot of damage to your body and brain. Okay? So avoid drugs. Okay? Don't take drugs. Better not to take drugs at this age, because the moment you go, you keep on taking it, you will start getting into the severity problems, and then a lot of damage will occur. Okay? Next slide. So I've already talked to you about this. Use your creativity or practice your hobbies. How many of you can play music here? I used to be a flutist, but now no time. So how about others? Yeah. What instrument you play, ma'am? Sorry? Piano. Excellent. Beautiful instrument. Anybody else? Yeah, go on. What instrument do you play? Guitar. Very good. Any other? Yes. Harmonium. Excellent. Any others? Nobody from top, huh? Nobody from the... Any other instruments? Yeah. So there are a lot of, it's not only that you have to be a musician, sometimes even listening to music can help you. Okay? Just listening to some nice soothing music after a tiring work or after a college can actually relax you. And when you play that instrument also, you feel very proud of yourself that I'm able to play this music. Okay? So, or cultivating a creativity. Many of my doctors in St. John's actually are artists. They do beautiful paintings, especially after whatever they see. Okay? One of our surgeon is there. His name is Dr. Rakesh. So every day today, whatever is happening, he will actually put it in painting. If there is pandemic, he'll put a painting for that. If there is someone, some major national level news is there, he will draw something related to that and he'll post it. So you have to be creative. Okay? Creative can be anything. If you know how to make a aeroplane out of a small paper, okay? If you can do some games, even games you can play, no? So develop one small habit, a good habit. Be creative, like drawing, or it could be games, or it could be something which you like to do, something me time. So utilize that me time that time. So you will feel happy about yourself. Okay? So utilizing that time for yourself and feeling very proud of that. No, whatever activity you do, like some of my patients are artists. The beautiful arts they make, tattooing. So many types of creativity they have. So when they come and tell us, we appreciate them to do that. So develop one at least, not if you have many, it's good, but at least one creativity which throughout your life. I was very interested in flute, so I used to started learning it properly. It took 2-3 years to learn, but I learned it properly, Carnatic music. Then I slowly went on to play in my medical college and won a lot of awards. So it's a good thing for you. Like when you feel happy about yourself, you're able to do something good. So develop a creativity. Next. I think I already spoken to you about this. So what is the minimum time you need to exercise? Let's say you don't have much time now, but what is the minimum time you're supposed to exercise? Okay, I'll give you the cutoffs. You can raise your hand. How many of you agree that minimum time should be 30 minutes? Raise your hand. Okay, put it down. 45 minutes? Only one madam is saying 45 minutes. Very few. 1 hour? So 3 of them, 4. Okay, 4 of them are saying. If you want to lose weight, you need 1 hour of walking daily. How much? So it will manifest to how many steps? 10,000 steps approximately, or 4 kilometers. Okay? If you're cycling, around 16 kilometers. Okay? I also do cycling, so I'm proud to say that. So 16 kilometers of cycling, at least once in 2 days. You cannot do a lot more things. Also, please remember, don't overdo any exercise. You'll have repercussions. minimum mandated is if you want to lose weight, 1 hour of walking, simple walking, brisk walking, or 4 kilometers of walk, or at least 45 minutes if you want to maintain your weight, 30 minutes if you want to maintain your heart well. Okay? So you decide how you want to break that time. Okay? You can do it in the morning, night, preferably not in the night. Evening is okay. And you can break it also. If you want to do 30 minutes morning, 30 minutes evening, that's allowed. Okay? So this is what is generally advised. Okay? With your physical exercise, you also have to diet. Okay? The main culprit is carbohydrates. Cut down on your carbohydrates. You can eat a lot of non-veg, no problem, but carbohydrates you should cut. Rice, okay? Cut down on rice. Idli, South Indians are known for that, no? Idli, vada, dosa, all those things. You know how much one masala dosa contains? How many calories? One masala dosa, any typical masala dosa you eat anywhere outside, how much calories it contains? Guess, take a guess. How much calories it contains? Nobody's clueless, all are clueless. It has 2,400 calories. It is enough for your lunch actually. So one masala dosa is enough for your lunch. So be careful about, conscious about nutrition also. Eat lot of fruits, vegetables. Okay, occasional non-veg is allowed. Okay, if you're eating chicken, eat without skin. Okay, so if you can avoid as much as fat as possible, you'll be a lot more healthy. Okay, is it clear? So please be conscious of what you eat. What you eat is who you are. Okay, be conscious of that because it has a lot of repercussions on the weight also. Next. Spirituality and religion. Okay? Do you think these are important? Is there anybody in this room who does not believe in God? Atheist? Okay, there's nothing wrong in that. Okay? Is there anybody who does not believe in God? Please raise your hand. So all of you believe in God? Huh? So you don't believe in God? Okay. You don't believe in God? Okay. Good. I'm happy you said that. So for them we have spirituality. Okay? You need not believe in God, but you can follow spirituality. What is spirituality? It is a kind of same what I taught you, relaxation. Okay, some hope is there. Okay, you don't, the spirituality does not follow any religion. Okay, so you can take any kind of a spiritual, you can meditate, you can follow their rituals. Okay, whereas religion, it depends on the religion. They believe in a supernatural force and you follow according to the rituals or practices followed by them. Okay, it's always better to what studies have said, that if you are religious or spiritual, there is less chance of you committing suicide. And in fact, certain religion bans suicide. So do you think it's good or bad? Banning suicide is good or bad? Earlier in Catholic or Christianity, when there was a very clear message that if you commit suicide, you will not be given a grave. So many people used to avoid committing suicide. Okay? In Muslim, again, they are also very clear that you cannot commit suicide. And also, drugs of abuse are banned in Muslim religion. So like that, even Jains believe you should not even hurt. Why they wear a mask? You know why they wear a mask? Can anybody tell me why they wear a mask? Jains? Yeah. Yeah, go ahead. Go ahead and tell. Yeah, basically you're not going to harm the germ also. Okay? So that much concerned they are. Okay? So very important is Jains, that's why they don't eat non-veg. Why? Because they feel that they should not harm any animals. So each religion has some beautiful things in them. rituals. Whatever religion you are, be honest to that religion. But if you don't believe in God, leave alone. It's okay, no problem. But you can follow some spirituality. A lot of people go on treks to understand about spirituality. It is nothing but understanding yourself in the end of the day. Okay? So having some religious connections, meeting if you have, when you're down, when you're feeling sad, okay, you feel that, no, I'm feeling this is my end. You can always talk to someone, a sister, a nun, or a Swamiji, or a father. You can go talk to them. There's nothing harm in that. They will give you a lot of good advices. If you can take that, that will be really great. Sure. So it's very important to have some connections with the religion and also spirituality. Okay, next slide. So keep track of your mental health concerns. Let's say you're having sleep disturbance, you're not feeling like eating food well, feeling sad most of the time, okay, or feeling anxious about small things. Sometimes we neglect our mental health issues. What happens if you neglect it? It will come one day, like a pressure cooker. It will keep on building slowly, and suddenly one day it will burst out. So don't hold back on your mental health issues. It could be a simple anxiety. If you don't take care of it now, later on it's going to give you a problem. Okay? See, the problem is a lot of people have stigma related to meeting a psychologist or a psychiatrist, but it is at the cost of your own health. So it's very important to understand what you're going through. You can talk to your friends. There's nothing harm. You can talk to your parents. You can talk to mental health counselors. Student counselors are there in most of the colleges. You can go talk to them about your problems. Okay? If it is really worst, for you to a psychiatrist or a psychologist. And there's nothing harm in meeting them. Okay? Many people are doing very well with the proper kind of treatment. And all psychiatrists will not start you on medication unless and until there is a major problem. Okay? Next. Utilize mental health services. Okay? So not only your own student college counselors or your friends who advise you, but you can actually approach a lot of medical colleges or private psychiatrists, psychologists who are there to help you. Okay? It's only just making that few steps and taking that appointment and seeing the psychologist and psychiatrist. So there are a lot of services available. Even if you can't afford it, there are a lot of free services given by a lot of counseling agencies. You can approach, and even nowadays online help is there. Even government of Karnataka has a lot of services. It is available at all the health and wellness centers in our Karnataka. I can proudly say about that. No, there is something called Telemanas which is available. If you can't afford also, it's freely given by the government of Karnataka. Okay, so you can utilize those services. Next. Okay, so all this while I was talking about how you can foster your resilience, or how you can improve your resilience, how you can seek help, how you can change your life. Now, very briefly for the colleges or university. If any of the administrators are there, it may just help you. Very briefly, next slide. So, it is very important to start the conversation of mental health and increase communication in the colleges. So, many colleges don't want to talk about it. If you don't talk about it, what happens? Your students are going to harm themselves in some way or the other. So it's very important they communicate it properly, give a lot of information, and that can help the colleges a lot more. Next slide. Make mental health promotion and suicide prevention a campus-wide effort. So it's not only one class, two class which is interested, but the whole university should be interested. They should make information available and how they can take help, giving that confidence in the students, privacy for them, and how they can refer them to mental health professionals if required. So making health promotions, mental health promotions, talking about depression, talking about suicide, talking about various major psychiatric disorders can really help. Very important, involve students, faculty, staff in the development and implementation of mental health campaigns, services, resources, and support. Basically, establishing a support system. If there is support, if you know that I can approach somebody, I can discuss about my problems to them, definitely that will help you a lot. And some kind of privacy is maintained and confidentiality is there. People feel a lot more comfortable to talk about their problems. Cities can set up rooms where or the counselors are available. They can go approach the counselors and take it. Next. Integrate it into academic and student life and follow up with resources and support systems. So basically, teach them, like how I taught you a simple relaxation, teach them some small skills themselves and modify themselves and are able to have a lot more benefits from those aspects. So very important is schools have life skills programs. In fact, NIMANS has come out with a life skills guidelines. WHO has a life skills guidelines. If any of the university are interested, they can download that and utilize that. Okay? So the universities can use life skills and incorporate that into the academy. So they can have one particular class in a week where they can do something on relaxation or teach them how to do arts, hobbies. So they can invest on that actually. Next. Next slide. Make sure information about services and supports are readily available and communicated to the students. It's very important. It's not only you have a setup, you have a counselor sitting there every day, but you have to inform that to all the students. So put up posters, put up information on the net so that people can access them. The timings when they are available, in a crisis what they can do, whom can they call, okay? You can even identify some peer group who can actually support their juniors when they are in a crisis. So having information about that services can be really helpful. Next. Assess the needs of students and take a staged approach to meet their needs. So all are unique. Nobody is, you cannot just give a generalized plan for everybody. Each person is unique. So the plans, what you're going to tell your students is going to be very, very specific to that person. So don't give a generalized plan, but very tailored plan to the students so that they benefit from that. Okay? You have to look at their socioeconomic background, where are they coming from, what are the language barriers they're going to have. Okay? All those issues need to be considered. Okay? And then help them. Next. Collaborate with outside organizations and the community. So we have come to the last slide. So collaborating with other universities, for example, collaborates with St. John's, and we do a lot of programs like this. So similarly, we also refer our patients to TREDA. Most of our patients come here and take rehabilitation and then go away. They do very well. Okay? So having some kind of a setup with the universities and nearby institutions who look into mental health aspects can be very, very helpful. So with this, I will stop my talk. Any doubts or clarifications you can give me. Any doubts you can ask me. Can use this mic.
Check. Thank you, sir, for advocating us towards our own mental health and well-being. This was indeed an interactive session, wasn't it, guys? All right, it's time. We give a huge round of applause to sir. Can we please have a huge round of applause from all the participants? I now encourage all the audiences to come up with their questions. Do you all have any questions? Please put your hands up. We have a question at the back. Our volunteer will reach out to you. Please wait.
Good morning, sir.
Good morning.
Yeah. Sir, can you tell me about the life skill guidance? Can you just advocate about it a little bit more?
Yeah. So life skills are basically whatever I told you today. Okay. It talks about physical health, relaxation, have a good nutrition, good sleep, good appetite. Okay. Cultivate good habits like creativity, what I told you, hobbies. So these are all given by WHO. Okay. That's nothing new. It is all same what we are all already practicing, but in a little more technical manner. So if you can follow this, definitely your life will be in a better frame of mind. And these are essential components of your mental health also. Okay, you got it?
Thank you so much, sir.
Sure, thank you. Any other questions? Madam. Ma'am, introduce yourself and then maybe you can tell us. Can give this mic.
Yeah, my name is Mary.
Yes, ma'am.
I'm a psychiatric nurse. Actually worked in St. John's for 22 years, and unfortunately after I left you joined. Okay.
Okay.
Doctor, you talked about IT people not going against the law of nature, not sleeping at night. I have always been concerned about the nurses and doctors who have to do night duty. And especially the trainee doctors, they say they don't get a break. Sometimes they do for 36 hours continuously, etc. Day, night, again, day. It is not possible that doctors or nurses don't do duty at night. That is impossible as long as we have inpatients. But we can provide facilities for those, and how do you promote that? How do you advocate for their mental well-being? That's my question to you.
Sure. Thank you, ma'am, for asking that question. In fact, one of my orthopedic PGs, not one, all the 6 people were referred to me at the same time, same moment by their HOD, saying they're not working. Okay? So I said, okay, there's nothing wrong in seeing all at a time. There's a common kind of a problem. So I asked them, so they were telling me, doctor, we don't get time to do this, that, we don't sleep, we sleep very late. So I said, okay, you will have Sunday off, isn't it? They said, what Sunday? They never get a Sunday off also. So the problem is not only with the doctors, not only with the nurses, but even everybody working in the medical field goes through that. So now NMC has mandated very clearly that they cannot work beyond certain hours. Okay? So we have to change our mentality about that. So we need to employ more people. That is one solution. Number 2, definitely making sure that if you don't give continuous night duties for a month, because changing that is very difficult. They'll have a lot of jet lag and shift problems in the sleep. So maybe once a week, or sorry, a week, and then they let off for 1 or 2 days and they get back to the system again. So giving them time to get back. Okay? So night duties are mandated. In fact, we'll be there to take care of the patients otherwise. So in a staggered manner, you don't give them continuous night duties for 1 month, 2 months. The same thing happens even in the work field also, where they're given shift duties. So they keep rotating that shift duties. So some work in the morning, some work in the afternoon, some work in the night. So they rotate it. So by doing that, you don't get the ill effects of doing night duties. So my solution is hire more people. Number 2, don't give continuous night duties. Maybe once a week can be given, and then it can be, the others can take a rotation. That's how we used to do as postgraduates. And having sufficient time for them to relax and get back to regular kind of lifestyle. So I think beyond that, and right now the NMC is very clearly laid down guidelines saying postgraduates cannot work beyond certain hours. You cannot force them to work certain hours, and night duties have to be considered carefully. So it's very important to take care of the mental health of all our medical fraternity also. Thank you.
Thank you, sir, for fostering awareness through those answers. Thank you, audiences, for the questions. Any other questions we have, we'll address that towards the end of the day. Thank you, everyone.
Ladies and gentlemen, if I could have your attention, please. We are thrilled to have an exceptional group of guests with us today. As we begin this event, I would like to invite our distinguished guests to take their seats. As our guests settle in, can we please give them a warm round of applause and welcome them? Thank you. We kindly ask our guests to please be seated. You can continue clapping because clapping has proven to, maintain your blood pressure levels. And it spreads happiness as well. Great, a bit louder. Thank you, everyone. Thank you for being such an amazing audience and for such a cheerful welcome. And now, the time has come to illuminate our gathering with the light of knowledge and unity. I kindly request our esteemed guests to join us on the stage to light the lamp. Thank you so much. Thank you once again. Beautiful music of the prayer coupled with the lamp lighting is just the perfect combination. I will now request our guests to please take your seats. Thank you.
Each program requires an introduction and welcome, and it is my pleasure to introduce Ms. Prashanthi, Head of Department of Counseling, TREDA, who will now deliver the welcome speech. Please, ma'am.
Thank you so much, Rio. Namaste to one and all present here. Namaste, guest. I, Ms. Prashanthi Casey, psychologist, on behalf of TREDA Mental Health Wellness Organizing Committee, I warmly welcome you all to the National Mental Health Seminar focusing on fostering positive mental health in students. Mental health is not negotiable. As future mental health professionals, researchers, and caregivers, you are the champions of change. Your dedication to the field of psychology, nursing, and psychiatric nursing will shape the lives of countless individuals and communities. It's time to acknowledge the valuable presence of our dignitaries and students representing various institutions. I would like to call upon Ms. Pravalika SG, the HOD of Training Institute, to felicitate our esteemed guest. Let's together cheer up for Dr. Kiran Kumar, psychiatrist, director of Nirvana. Dr. Oliver Rogers, family medicine. Shri K. Nagaraj, chairman of SJC College. We welcome you, sir. We have the star for the day, Dr. Jaika Shetty, sir, Vice Chancellor, Bangalore University. We welcome you, sir. Guys, give them a round of applause. We welcome the other bright star for the day, like Dr. B.L. Sujata Rathore, Directorate of Medical Examination. Give them a very round of applause. We welcome you, ma'am. And we have Father Shinto Matthew, Director of TREDA. We welcome you, Father. And I would like to welcome Dr. Lingarajo G, General Manager, TREDA. We welcome you, sir. And we have Mr. Venu Reddy, sir, from Spurti Institutions. We welcome you, sir. We have Dr. Mamta Shetty, psychiatrist, TREDA. We welcome you, doctor. And I would like to welcome Dr. Johnson Padi, the HOD of Psychiatry, St. John's Medical College. Welcome, doctor. And also, I welcome students from various institutions, SJC Nursing College, T-John Nursing College, Spurti Nursing College, S. Vyasa University, Quality Nursing College, Kripanidhi Nursing College, Vishwasai College of Nursing, Christ College, Ashwantpur, SFS College, and Asan Medical College, and Jahan Nursing College. We are delighted to have you all here with us today. This seminar is designed specifically for you to equip you with the latest knowledge, skills, and best practices in promoting positive mental health. We will delve into the complexities of mental health, explore innovative interventions, and discuss the importance of self-care and burnout prevention. Over these last 3 hours, you have engaged with renowned experts, share your own experiences, and network with like-minded individuals. You'll gain insights into evidence-based practices in mental health promotion, interdisciplinary approaches to care, cultural competencies and sensitivity, emerging trends and technologies in mental health. As future leaders in your fields, You have the power to create a ripple effect of positive change. Let's work together to break down stigmas surrounding mental health, foster inclusive and supportive environment, prioritize mental health as a fundamental aspect of overall well-being. Thank you for your passion, commitment, and dedication to mental health. Let's make a meaningful difference together. Once again, welcome you all for this wonderful event. Have a wonderful day. Thank you.
Thank you for the warm welcome. We truly feel gratefully to be part of this incredible gathering. Thank you, ma'am.
I now call upon Professor Dr. Jaykara Shetty M., Vice Chancellor of Bangalore University. Under his dynamic leadership, Bangalore University has continued to grow as a premier institution of higher learning committed to excellence in education, research, and community engagement. He has been a driving force behind numerous initiatives that have significantly advanced the university's mission. Their vision for academic innovation, dedication to fostering a vibrant learning environment, and commitment to upholding the highest standards of education have greatly contributed to the university's success and reputation. I welcome you, sir, to speak a few words for us, please.
Very good morning to all of you. Respected dignitaries, Dr. B.L. Sujata Rathod, Director, Minto Hospital, Director of Medical Education, Government of Karnataka, Reverend Father Shintu Matthew, Managing Director, TREDA, Mr. Vinay Reddy, Chairman, Spurti Group of Institution, Sri K. Nagaraj, Chairman, SJE's Group of Institution, today's speakers, Dr. Johnson Pradeep R., Head Department of Psychiatry, St. John Medical College and Hospital, Sri Kiran Kumar, Psychiatrist, Vaidehi Institute of Medical Science and Research Center, Dr. Mamata Shetty, Psychiatrist, TREDA, and today we are celebrating 31st Foundation Ceremony, National Mental Health Seminar, TREDA Institute of Mental Health and Wellness Center, all the organizers, delegates, and my dear friends. As you all know, the mental health is very, very important. As per WHO, the health is the complete state of physical, mental, and social well-being, not merely absence of disease or infirmity. And recently, I have read in newspaper, and NMC, as you all know, is an apex body for medical education. They have conducted a survey among the interns and postgraduate students. And they said, and more than the 40% of our interns and postgraduate students, they are in stress. Because, you know, the lot of workload and number of working hours also more. They are day and night working in the hospital, and uh, it has appeared in the paper, and many of the interns and postgraduate students, they felt like committing suicide because of stress. It is a very dangerous and alarming trend. And even not only in India, even everywhere, even all other countries also, we are facing a lot of the mental health problem. You don't have to control your thoughts, you just have to stop letting them control you. Dan Millman. I want to take this opportunity to talk about something that touches each of our lives in profound way, our mental health. In our fast-paced, achievement-oriented world, mental health often takes a back seat to physical health. We are encouraged to eat well, exercise, and get regular checkups. But how often do we give the same attention to our mental and emotional well-being? There is a common misconception that mental health issues are rare or a sign of weakness. In reality, they can affect anyone, and acknowledging them is a strength, not a weakness. Just as we would not ignore a persistent cough or a ankle pain, we should not ignore the sign of mental illness or distress, whether it is anxiety, depression, or a chronic stress. These conditions are just as real as physical illness and deserve the same level of care and attention. The poor mental health can impact every aspect of our lives, our relationships, our productivity, and even our physical health. The chronic stress, for example, has been linked to heart disease, weakened immune function, and other serious health problems. On the other hand, nurturing our mental health help us cope with the life stresses, work productively, and contribute to our communities. Despite the importance of mental health, still many of us face barriers when seeking help. The stigma remains a significant issue. The people may feel ashamed or embarrassed to admit they are struggling. The fearing judgment or misunderstanding from others, but we must challenge these stigmas and encourage open, honest conversation about mental health. Related to mental wellness, it is not just about addressing issues when they arise. It is about taking proactive steps to maintain a healthy mind. Regular exercise, adequate sleep, a balanced diet, and setting boundaries, engaging in hobbies, taking time for relaxation, and practicing healthy lifestyle all play a key role in supporting mental health. Let us make mental health a priority in our lives and communities, whether it is taking care of ourselves or supporting others or advocating for mental health resources. We all have a role to play in promoting wellness for overall well-being. It is not the load that breaks you down, it is the way you carry it. Remember, taking care of your mind is just as important as taking care of your body. Thank you one and all.
Thank you so much, sir, for inspiring us with these valuable words. We really appreciate it. Thank you.
I'd now like to call upon Dr. B.L. Sujata Rathore, Director, Directorate of Medical Education. She is renowned for her unwavering commitment to enhancing medical education standards, fostering professional development, and ensuring that medical institutions across the region adhere to the highest standards of excellence. We welcome you to speak a few words, ma'am.
A very warm good morning to all the dignitaries on the stage, the Honorable Vice Chancellor of the Bangalore University, Dr. Jaikar Shetty, who is a dentist by profession and the one person who will make people have good smiles. Dr. Oliver, Dr. Mamta Shetty, Dr. Johnson from St. John's Department of Psychiatry, then Vinay Reddy, Father, Dr. Kiran, and of course, lot of dignitaries off the stage, senior faculty, students, doctors, nurses, counselors, ladies and gentlemen. A warm good morning to all on this 31st Foundation ceremony, the National Mental Health Seminar, where mental health, the theme is that fostering positive mental health in students, and to say that, as Dr. Jaikar Shetty said, where we look at health, not just the physical well-being of a person, but also the mental well-being in order to cope and do things which make us happy and make a difference to our surroundings. That is being in positive mental health. This mental health is definitely not negotiable. So I'm glad to be here on this morning with this particular subject, because way back, before I took on to becoming the director of Minto Eye Hospital as an ophthalmologist, I did have a passion to look into the mental diseases and the treatment of various psychiatric illness in NIMHANS as a non-course junior resident. And I can say that it was very close to my heart, because in this particular phase where we need to create a wellness with regard to mental health, communication is the main key. And that shall become the most important to our younger generation, because we have seen that the younger generation does not have communicative skills in face-to-face with our patients or with the family or friends, because they all have got so absorbed in their device-oriented world. That is, they're so busy with their mobiles, their tablets, and the media, the social medias which they are on, be it the Twitter to anything, where they prefer to be in a real world and do so many things, but they do not want to be in the real world with the family or friends and have a great deal of communication. So first, I feel the most important thing for this generation, for these students, is to learn the art of communication, because medicine is not just a science, but it's also the art of giving well to our patients. And that, dear students, you should be well communicative with the greatest of ethics and the greatest of values. That creates positivity towards your patients, towards your way of looking at things in life, and I'm sure that remains the most important thing. If you are positive about the things happening in your life and the way you can tackle those challenges and emerge as a successful person, you will help the patients in front of you do the same. So, in order to understand what we need to have a positive mental health? What are the things, simple things we need to do to have, to remain positive? I think it's the inner awakeness which we need to have. In first, having gratitude towards the divinity, which is the main responsible thing for us to be in this world. Next, towards our parents who have got us to this world to do the best we can on this in this materialistic world. So learn to be having gratitude towards all these people and towards the teachers who mold you during the formative years. So first and foremost, this good value of being grateful to the people who have formed you and helped you to become a responsible citizen in the society, that takes you a long way towards being mentally healthy. Well, we all live in a world which is not easy. Life is definitely having a lot of challenges. Life cannot be a simple straight line, because if it is so, then we are more dead than alive, because the ECG also has the ups and downs. That indicates that we are healthy and kicking life and doing things towards a positive way. So remember, in this phase of life, or in life which is so complicated, you can make yourself, make the life simple by accepting challenges and having great coping skills. And again, these coping skills do not come from your devices, but they come from your experienced parents, the family, the teachers. So, dear students, learn to be communicative with them. Communicate on every failure you have and learn to climb up towards success with the help of family and friends. And you're in a field where ethics, integrity and honesty is most important. So if you perceive these values within you and take the help of your family and friends, you shall remain and become compassionate and have a continuum of care for your patients. All this will take you towards positive mental health. Challenges will be there, failures will be there, but it is this support system which you should look upon and put a positive foot always in your life. Of course, India has been the leader in a lot of coping skills and meditation. So, though many of us are allopathic doctors where medication is the key for various conditions for treatment, let's take a step backwards and look into preventiveness and go into the age-old concepts of yoga and meditation. That again will make us more positive, give us more inner strength and make us positive in the society to take care of the various problems. So, it's important that we realize that we are not here only to always keep working. All work and no play will definitely make John a very dull and boring boy. So, you need to learn and accept self-care. You have to accept that you can become the best version of yourself. So, learn to pamper yourself so that you can come out more positively and give the best to the society. Well, we have in our own Indian value system, if you look at the mythology or the various things which we have learned from our mythology, one thing is most important is that we all have believed in the path of righteousness, be it whichever religion. Dharma or righteousness is what we all look into. And to move towards it, we have a lot of sacrifices. We need to do tyaga, we need to have dedication. So these are all inbuilt within our Indian value system. So this, again, if we put into our medical education system, which is very much coming as the attitude, ethics and communication skills, known as the ATCOM. This is one of the modules which NMC has put across. This will help us to retain and look very positively towards the people and become the beacon of hope and help to the patients. Well, as you have wonderful speakers who are going to speak to you on the topic of fostering good mental health and making you realize that mental health is not negotiable. With these few words, I would like to wish the conference or the seminar a grand success, and I hope that all of you students make good use of this and remember that every purpose of life is to make a difference to our surroundings, and let's all do it by remaining healthy, be it physical and mental. Dr. Jaikar Shetty has already given the other various key elements to make yourself not just mentally healthy, but physically healthy with a balanced diet and exercise being one of your main priorities. But remember, as a human being, it's the inner values and the external values of the society which make you an excellent human being. And this birth or this life which God has given us, we can definitely we can put it to great use by the skills we learn, be it as doctors, nurses, counselors, and various healthcare providers. We shall stand and take a pledge towards making the whole atmosphere more positive and taking care of patients in a very positive way, so that we embrace or create an environment of wellness always, more than just treating the diseases. So the youngsters, I would say that you can use the technologies where you go into making TikToks or reels about various songs and dances. Instead of that, you're in a profession where you can create more awareness on the good things and good health of the society. So be it on the various aspects of good healthy eat media, that will be one good way of you becoming ambassadors of good health, rather than just getting addictive to these devices and try to keep only into the various environmental or entertainment factors. Well, one last word. Let's not become addictive to the multiple vices which we have in the society, because that will take you down and down into a deep tunnel, and it will be very difficult for you to emerge out. I think most of the youngsters know that drug menace is one of the strongest addictive things that the younger generation is facing. And I am glad to be here with the TREDA, because TREDA's mission is to create a drug-free society, and this is truly inspiring. And I feel that parents, teachers, everybody should be more open about this menace and jointly work towards it, to creating a younger, healthier India, so that we can definitely contribute to a better tomorrow. Well, to end it all, I would thank the organizers of TREDA for their approach to mental health and making a good approach to the society in order to create a better outcome of our students, and their passionate team. I thank you all for having me here on this beautiful morning to just share my few thoughts. Thank you. To end it all, yes, we have on paper a lot of things. Be it NMC, they have a task force specially to looking at the mental health of our students. What is on paper, let's all put it into reality, because ground realities are much, much different. But in our systems, we do have this, as I told you, I think communication being the main thing, we should have a one-to-one system of mentor-mentee system. Besides the family values you have at home, with your teachers, if you continue to have this wonderful relationship, you shall become a very, very positive person to face every challenge in life. So wishing you all a healthy, positive future, I would end my few words to this particular August gathering. Thank you.
Those were true words of inspiration. Can we all give a huge round of applause to thank ma'am? Thank you for the insightful sharing, ma'am.
I now request Dr. Mamta Shetty, our beloved psychiatrist at TREDA, to share her insights in the field of mental health. We welcome you, ma'am.
Good day to all, respected guests and the students. I've not come here to give any lecture because I was not supposed to talk. Last minute they asked me. Anyway, I want to say a few words about the Institute TREDA. TREDA started around 31 years ago by Sister Lily Chinkapura. At that time, it was mainly concentrating on treating drug abuse, alcohol, and helping people, especially the lower social strata illness people. Now, slowly, we are moving on to the prevention and promotion of health. So on this regard, we are having a series of programs. Recently, we have had some conference of Catholic people who were involved in mental health. So this is the second program. We are dealing with students. I'm sure, at least if not all, many of you would have heard Dr. Kiran's speech where he stressed on the students' problems, which usually starts around adolescent age, because of the stress, either suicide or getting onto drugs. So as a preventive measure, what can be done? So you all have to think about it. Now, I would request all of you to stand wherever you are sitting. Please stand. Let us take a pledge to help ourselves. All of you, put out your right hand at 90 degrees and pledge that I will do whatever possible from my end to improve my health, both physical and mental health. I will try to prevent the possible problems faced by people in and around me, in my family, in my neighborhood, among my peers. I'll see that I help people who slowly getting on to developing suicidal thoughts or facing stresses or slowly getting on to drugs of abuse, help them to come out of it and thereby help the student community. Thank you. Thank you all.
Thank you so much, Dr. Mamta Shetty, for your valuable words. Also, we really hope and pray that you all remember the pledge and make the world a better place for yourself and all the people who cross your paths in this life's journey. Thank you so much.
We would now like to felicitate our guests with a memento. I'd like to call upon Father Shinto Matthew to do the beautiful deed. Please, Father. Let's start with Professor Dr. Jayakara Shetty. Please, sir. Can we please keep the applause coming as we offer the memento? Thank you, Father. Thank you, sir. I'd now like to call upon Ms. Pravalika, Head of Department of TREDA Training Institute, to present the memento to Dr. B.L. Sujata Rathod. Please, ma'am. Can we please have the applause coming? Thank you, ma'am. I'd like to request Father Shinto Matthew to present the memento to Sri P. Venu Reddy, sir.
We have found the music which will match with your clapping. So come on, let's enjoy the felicitation process. Everyone, then you'll be hungry and we'll send you for lunch soon.
That definitely helps. Thank you, sir. We'd like to felicitate Shri K. Nagaraj. please do the deed, Father? Thank you, sir. We'd like to felicitate Dr. Johnson Pradeep R. We request Dr. Lingaraju to do the deed. Can we have applause going louder than the music? Do we have it in us? Thank you, sir. We'd now like to felicitate Dr. Kiran Kumar with the memento. Please, sir. We need louder applause from the back and from the front. It's time to felicitate Dr. Mamta Shetty. Please, ma'am. Can we have Miss Pravalika do the deed? Let's put our hands together. That's the rhythm we need, yes. Finally, but importantly, we'd like to felicitate Dr. Oliver. Please, doctor. Finally, but importantly, let's have the applause coming in louder. Thank you for the beautiful presents. We are really grateful to have each one of you on dais today. Can we please give a huge round of applause for our esteemed guests? Thank you, beautiful audiences.
And now, we would like to give our token of love to Chai Karnataka for their support and partnership with us. Father Techi, can we please have you on stage? Thank you. A huge round of applause, everyone, please. Thank you. We call upon Father Shinjo Matthew to do the honors, please. Excellent work. Thank you so much. Now we would like to extend our token of love for Carmel School for their valuable support in the field of mental health. Can we have Mr. Raman Janappa on the stage, please? Thank you so much, sir, for your valuable contribution. huge round of applause collectively for all our dignitaries and sponsors. 3, 2, 1. Thank you.
It is rightfully said that living in gratitude is a gateway to grace. And to bestow grace upon all of us present here, I now welcome Ms. Prashanti to deliver the vote of thanks to the audiences. Can we please welcome Ms. Prashanti with a round of applause?
Thank you so much, Rio. I, Ms. Prashanti Kessi, psychologist, dear esteemed guests, speakers, participants, and organizers. As we come to the close of this successful National Mental Health Seminar, we extend our deepest gratitude to each individual who has contributed to the success of this National Mental Health Seminar. To our speakers and keynote speakers, your expertise and passion have inspired us to think differently, to act boldly, and to prioritize mental health. Your contributions will have a lasting impact on our understanding and approach to mental wellness. To our students, psychologists, psychiatric nursing, and nursing professionals, your engagement, curiosity, and commitment to mental health are a testament to the power of community and collaboration. You are the future leaders and change makers in mental health care. To our management, college managements, and committee members, your leadership, guidance, and support has been instrumental in shaping this seminar. Your trust and confidence in us have enabled us to bring this vision for life. To our backstage crew, coordinators, sound and live streaming teams, your tireless efforts, technical expertise, and attention to detail have ensured a seamless and professional experience. Your work behind the scenes has allowed us to focus on the content and connections. To our sponsors, your generosity and commitment to mental health initiatives has enabled us to create a platform for knowledge sharing, collaboration, and positive change. Your support has made a tangible differences in our ability to host this seminar. Thank you all for your collective efforts, dedication, and passion for mental health. This seminar has been a testament to the power of collaboration, community, and shared purpose. Let us continue to work together to prioritize mental health, change stigma, and promote wellness in all aspects of life. Thank you, everyone. A reminder and a note to all. Now, as we look to the future, I'm pleased to announce that our next event will be the 31st Foundation Day celebrations, starting on 20th of August by shortly. This milestone marks a significant achievement in our journey towards promoting mental health and wellness. Join us as we reflect on our accomplishments to honor our founders and look forward to the next chapter in our mission. We have an exciting lineup of events and activities planned, and we would be delightful if you could join us. Let us continue to work together to prioritize mental health, challenge stigma, and promote wellness in all the aspects of life. Thank you, everyone.
I'd now like to invite Ms. Pravalika to felicitate with a token of memento to Mrs. Gana Reddy. Can we have Mrs. Gana Reddy on stage, please? Can we please have her on stage with a huge round of applause? Ma'am has been working as a psychologist. She's an exceptional individual. Thank you, ma'am. Well, to encourage, we need to clap for mental health. Let's have the applause coming. Thank you, ma'am. Thank you, everyone.
Okay, while we have our dignitaries here, if we have any more questions, please raise your hands. We'll bring the mic to you, and they are more than happy to take any questions that you may have. Please raise your hands. Anyone from the top row? Any questions? We will be soon proceeding into lunchtime. We will let you know the exact time when we can set you free for half an hour, because we want you back here after you have your lunch, because that will be a good break, right? How many of you are hungry? Wow, as expected, I'm hungry too. We'll be giving out certificates for today, especially to those students who will be staying back for the seminar as well as the Foundation Day celebrations. We will also take at least 2 to 3 days time before we issue the certificates to you. So just a briefing about what happens after lunchtime. One, we will have wonderful speeches by two of our speakers, Mr. Saji and Ms. Tina Johnson. And we will also have our Foundation Day celebrations. We will have some more dignitaries join us for after lunch for the Foundation Day celebrations. Now, before we'll have an activity to make you a little bit more hungry, and then you can eat as much as you want and come back to the hall. Over to Ms. Yash.
Well, hi everyone. Here's my youth, my dear students. Some people I really resonate with. So there's a small activity before we go for lunch. It's very simple. Do you all like clapping? Yes, no? All right, mixed reviews, but we'll regardless clap. So when I say clap, do not clap. And when I say do not clap, clap the loudest. This is just a little warm-up before you go fill your stomachs. So, do not clap. 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 Oh, somebody just lost. Do not clap. Do not clap. Do not clap. 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 Do not clap.
When I see you all clapping, and Ms. Yash says, do not clap, I'm reminded of my kids. I tell them, don't do this, and guess what happens? Have to do it, right? So, keep up the good work and give mummies a hard time.
It's the last round we take in. Do you all like snapping? Do you all have the ability to snap? Beautiful. We'll create a wave of rhythm so that the day goes on well. Now, when I say snap, do not snap. When I say do not snap, snap. Okay? Snap. Do not snap. Do not snap. We'll bring a twist to this. You all know the signals red, yellow, green? So when we say red, snap once. When we say yellow, snap twice. When we say green, keep snapping. Cool? Red, snap once. Yellow, twice. Green, keep snapping. All my students, please. Red, yellow, 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 green, green. This should be the loudest. Red, 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 yellow, 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 green. Thank you. You guys are beautiful audiences. We'll soon announce for lunch. You all might have to be seated for few minutes, 5 more minutes. The lunch is yet to be ready. Till then, your host is with you to not bore you all. Can you all please be seated? Just 5 more minutes. All right. My friends at the back, please be seated. The friends above, below, to the right and left, here's a small question. Can we have a volunteer with a mic? We need your engagement. Today's entire seminar is about mental health, which is why, what is, in simple words, mental health according to you? Any of you could volunteer. Any of you could volunteer and tell us what is mental health according to you. Please put your hands up in the air and we'll reach to you. What is mental health according to you? Anybody from the left, from the right? At the back? Or you can use any words to describe it. For example, calmness, peace, anger, anything. Let's express ourselves. Anybody would like to share? Well, 5 more minutes and the lunch is ready. Till the lunch is not ready, what? We talk, because we are students, right? And we are here for mental health. Mental health is all about expression. Can I have somebody volunteer, or I might just pick? All right, so would anybody like to tell me what's mental health according to you? Yes.
Satisfaction of mental health. Satisfaction of mind.
Satisfaction of mind. Well, that's a good add-on. Beautiful. Anybody from this side? Any friend of mine?
Be happy, make other people happy. According to me, that's good mental health.
Now, we'll twist the question to something else. There were some sessions on self-care, well-being. Any one thing that you do for your own self-care, for your own mental well-being, would anybody like to share? Be it journaling, walking, dancing, sitting quiet, anything. So my friends at the back, would anybody like to tell what do you do for self-care? Or what is self-care?
Self-care can be going to the salon and pampering yourself with a haircut, a facial or a massage. Does anyone want to know what I do for self-care?
Yes. Yes.
I spend 10 minutes each day with myself. Me and myself. And you've heard that word, me time? Nobody has me time, right? We can do everything, but spending time with yourself is a very big challenge. So everyone, try this. It will work wonders. You finish everything what you have to do 10 minutes before your sleeping time or 10 minutes after you wake up. It should just be you and yourself. Deep breathing, relaxation, making a note of questions that always trouble you. What challenges, right? Anything it can be. But as you spend time with your loved ones, your friends, teachers, people around you, don't forget to spend time with yourself. So that's what I do for self-care.
Thank you, ma'am. Anybody else would like to add on to that? Anybody from here? Can we clap for her? What do you do for self-care?
For self-care, usually when I wake up, I look in the mirror and I used to give flying kiss, and I used to write journals. And when I feel happy as well as when I felt sad at the time, I used to write journals.
Those were the loudest claps. Okay. Well, my folks at the right, what do y'all do for self-care? What is mental health according to y'all?
Miss Yash, ask a boy in this time.
Yes.
We want men to be more expressive. Come on, boys. Come on, you can do it.
What is self-care or mental health? Both of you will speak. First you. Anyone, quickly guys. We have our dear boys here. So can you all tell us, what do you all do for self-care or what is mental health? One word. Can we encourage our classmates to speak? Can we please encourage them?
Shout out for the boys. Come
Yes,
on, boys.
come on. One word for mental health. Wow.
Ma'am, I listen to music just for,
Excellent.
just that is okay.
That's amazing. That truly counts. Anybody at the back?
Check. Hello.
Just one word. Come on. Okay, anybody from here? One word for self-care. Take a stand. Take a stand. One word. One word, guys. Peer pressure. All right, that's fine. Anybody would like to volunteer and tell us? At the front, at the back? We'll soon reach there as well. All right. So just to check your activity and activeness right now, we are going to divide you into 4 groups. This group at the back is A, this is B, this is C, this is D. Remember, A, put your hands up, B, put your hands up, C, D. The only thing that we're going to do until we head for a lunch break is, we'll see who can clap the loudest. A, B, C or D. Hands are hurting? Okay. We'll make sure to do some self-care.
I'm the judge.
She's the judge. She's going to tell us who clapped the loudest. A, B, C, D. B. Stop. D. A. Stop. C. Stop. A. Stop. B. Stop. A. Stop. C. Stop. C. Stop.
Okay. Miss Yashpreet, we can have you back on the stage and we'll announce the results. Who all are excited about the results? You all did very well, audience. Come on, guys. To head back to the hall. Okay? You can use the washrooms, have water, have food, have a wander around. They have nicely manicured gardens and plants. And please remember these announcements regarding the certificates. So if you are here for the whole day, we'll be issuing certificates. Please give us 2 to 3 days time. And after lunch, we'll be proceeding with the Foundation Day celebrations. Thank you one and all. See you after your break. Thank you so much. Hello. We'll request everyone to please take your seats inside the hall. We are going to start our Foundation Day celebration soon. Please, everyone, take your seats in the hall. May I please request everyone to take the seats in the hall, please? Thank you. We are about to start our Foundation Day celebrations. Our guests for the day have arrived. Everyone, may I please request you to take a seat inside the hall?
Check, check. Students, please be seated as soon as possible. People at the back, please have your friends come in and be seated.
All of you who are eating, complete, aram se you can slowly go and take your seats, okay? No need to rush. Everyone here, please, can we request you to get back to the hall? You can keep eating, guys. Take your time. Oh, there's a party happening. Can we please request all of you come inside the hall? Thank you. We're about to begin the Foundation Day celebrations. Please come in. Yeah, Ashmita told me to take a photo.
Yeah, at the front. Please occupy the rows at the front. The ones who have come from upstairs, please occupy the rows at the front.
Guys, I request everyone to occupy the first seats. The ones who are in the back can step down, okay? Come down. Students at the back seat, please occupy the front seats. Come forward. I request the students to sit in the front seat. Yeah, we are just calling. Make sure everyone is there. Yes. I request the students to sit in the front seat, please. Occupy the front seats.
Hello.
Ma'am, how long does it take?
Okay, okay. Okay. Sure. Probably I'll go outside and tell them. No, 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 balcony. It's almost filled. Okay. 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 Oh, it's there, there. Take the cordless mic, yes. It's there next to the... Everyone, please settle down. People who are outside towards their right, please come inside and occupy the seats. Miss Yash, can I please have you on the stage? Thank you. Please come down and occupy the front rows. Thank you so much. Please come forward. You can come in the front seats. We have front seats vacant. Don't worry, we won't ask you questions. Come on, come on. Thank you. Please come. Come forward, occupy the front rows. Thank you. Please come and occupy the front rows. Thank you. Okay, I'll go in personally. Right in the middle, you can come in the front chairs. Students, can we please ask you to stay back and settle down, please? We are starting our session soon, our foundation celebrations. Thank you for cooperating.
Thank you everyone for coming in and taking your seats on time. May I have all of yours attention, please? People at the back. All right. Thank you everyone for coming in and taking in your seats on time. We'd now like to continue the National Mental Health Seminar and Foundation Day celebrations. So to further bask into the light of this day with energy and insights, I welcome each one of you to the Foundation Day celebrations.
I now request all the audience to kindly raise as our esteemed dignitaries arrive for the stage. Can I please request the audience to raise and applaud, thank you, for our dignitaries. Thank you. As per the ritual, we are just taking some photographs and they'll be walking on the stage. Shri U.T. Kader, Shri Salim Ahmed, Reverend Father Joe Kanandanam, Reverend Father Melvin, Reverend Father Shinto Matthew, Dr. Lingaraju Ji, Shri Shaji George Thomas, Reverend Father Mark, Shri Jobin John, and Shri U.T. Zulfikar Ali. We welcome you all. Please take your seats. Can we please request Shri U.T. Zulfikar Ali to join us on the stage? Thank you. May we also request Reverend Father George Kanandanam to join us. Thank you.
Welcome to our Foundation Day celebration. It's an honor to have you all here as we commemorate TREDA, Institute of Mental Health and Wellness, which has stepped into its 31st year of remarkable achievement and growth. Today, ladies and gentlemen, we not only celebrate our past successes, but also the promising future that lies ahead of us.
Now the time has come to illuminate our gathering with the light of knowledge and unity. I kindly request our esteemed guests to join us on the stage to light the lamp. Can we have a huge round of applause, please? As we proceed, with our Foundation Day celebrations, we have a cherished tradition to honor. Just like the nature around us, we like to cherish our near and dear ones in prosperity and in health. We would now like to invite our dignitaries to join in to water the sapling. Thank you. Thank you so much, dignitaries. Please take your seats.
It is my pleasure to introduce Reverend Father Melvin, Vice President of TREDA, who will now deliver the welcome speech. Can we put our hands together as we welcome Father?
Good afternoon. I would like to do my part in Kannada. Hope you will all understand, isn't it? Anyway, I have to, because this is a public meeting. ವೇದಿಕೆಯಲ್ಲಿರುವ ಗಣ್ಯ ಅತಿಥಿಗಳೇ, ಸಮರ್ಪಣಾ ಮನೋಭಾವವನ್ನು ಹೊಂದಿರುವ ನೆಚ್ಚಿನ ನಮ್ಮ ತಂಡದ ಸದಸ್ಯರೇ, ನಮ್ಮ ಗೌರವಾನ್ವಿತ ಪಾಲುದಾರರೇ ಹಾಗೂ ಅತಮೂಲ್ಯರಾದ ನಮ್ಮ ಎಲ್ಲ ಬೆಂಬಲಿಗರೇ, ತಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ಶುಭ ನಮನಗಳು. ಟ್ರೇಡಾ ಮಾನಸಿಕ ಆರೋಗ್ಯ ಮತ್ತು ಕ್ಷೇಮ ಸಂಸ್ಥೆಯ 31ನೇ ಸಂಸ್ಥಾಪಕ ದಿನಾಚರಣೆಯನ್ನು ಆಚರಿಸುತ್ತಿರುವಾಗ ಈ ಸುಸಂದರ್ಭದಲ್ಲಿ ತಮ್ಮೆಲ್ಲರನ್ನು ಸ್ವಾಗತಿಸಲು ನಾನು ಬಹಳ ಸಂತೋಷಪಡುತ್ತೇನೆ ಮತ್ತು ಇದು ನಮಗೆ ಸಿಕ್ಕಿರುವ ಸೌಭಾಗ್ಯವಾಗಿದೆ. ಇಂದಿನ ದಿನವು ನಮ್ಮ ಇಷ್ಟು ವರ್ಷಗಳ ಸುದೀರ್ಘ ಪ್ರಯಾಣದಲ್ಲಿ ಒಂದು ಮಹತ್ವದ ಮೈಲುಗಲ್ಲಾಗಿ ಮತ್ತು ಈ ವಿಶೇಷ ಸಂದರ್ಭವನ್ನು, ಇದರ ಸಂತೋಷವನ್ನು ತಮ್ಮೆಲ್ಲರೊಂದಿಗೆ ಹಂಚಿಕೊಳ್ಳಲು ನಾನು ಸಂತೋಷಪಡುತ್ತೇನೆ. 31 ವರ್ಷಗಳ ಹಿಂದೆ 1993ರಲ್ಲಿ ಸಿಸ್ಟರ್ ಲಿಲ್ಲಿ ಚುಂಗಪ್ಪರ ಇವರು ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯನ್ನು ಹುಟ್ಟುಹಾಕಿದಾಗ ನಾವು ಮಾನಸಿಕ ಆರೋಗ್ಯ ಮತ್ತು ಸಮಾಜದ ಮದ್ಯಪಾನ ದುಶ್ಚಟಗಳಿಂದ ರಕ್ಷಣೆಯನ್ನು ಮಾಡಿ ಭೂಪಟವನ್ನೇ ಪರಿವರ್ತಿಸುವ ಉದ್ದೇಶವನ್ನು ಹೊಂದಿದ್ದೆವು. ಸಹಾನುಭೂತಿ, ಹೊಸತನ ಮತ್ತು ಬೆಂಬಲವನ್ನು ಒದಗಿಸುವ ಸನ್ನಿವೇಶವನ್ನು ಸೃಷ್ಟಿಸಿ ಮಾನಸಿಕ ಆರೋಗ್ಯದ ಸಮಸ್ಯೆಗಳನ್ನು ಎದುರಿಸುತ್ತಿರುವ ವ್ಯಕ್ತಿಗಳನ್ನು ಅದರ ಬಗೆಗಿನ ತಿಳುವಳಿಕೆ, ನಮ್ಮ ಬಗ್ಗೆಯ ಕಾಳಜಿ ಹಾಗೂ ಅದರಲ್ಲಿ ಭರವಸೆಯನ್ನು ಕೊಂಡುಕೊಳ್ಳುವಂತೆ ಅವರನ್ನು ಶಕ್ತಗೊಳಿಸುವುದೇ ನಮ್ಮ ಸಂಸ್ಥೆಯ ಉದ್ದೇಶವಾಗಿತ್ತು. ನಮ್ಮ ಈ ಎಲ್ಲ ಉದ್ದೇಶಗಳನ್ನು ಈಡೇರಿಸುವಲ್ಲಿ ಬದ್ಧರಾಗಿರುವ ನಮ್ಮ ಉತ್ತಮ ಆಸಕ್ತಿಯನ್ನು ಹೊಂದಿರುವ ವ್ಯಕ್ತಿಗಳ ಒಂದು ಸಮುದಾಯವನ್ನೇ ನಾವು ಹೊಂದಿರುವುದು ನಮ್ಮ ನಂಬಿಕೆಗೂ ಮೀರಿದ ಸತ್ಯ ಹಾಗೂ ನಾವು ಅವರೆಲ್ಲರನ್ನೂ ಪಡೆದಿರುವುದು ನಮ್ಮ ಅದೃಷ್ಟವೆಂದು ಭಾವಿಸುತ್ತೇವೆ. ಸಮರ್ಪಣಾ ಮನೋಭಾವವನ್ನು ಹೊಂದಿರುವ ನಮ್ಮ ನೆಚ್ಚಿನ ಸಿಬ್ಬಂದಿಗಳು, ಸ್ವಯಂ ಸೇವಕರು, ನಮ್ಮ ಉದಾರದ ದಾನಿಗಳು ಹಾಗೂ ನಮ್ಮ ಪಾಲುದಾರರ ಸಂಸ್ಥೆಗಳು ಹಾಗೂ ವ್ಯಕ್ತಿಗಳು, ಇವರೆಲ್ಲರಿಗೂ ನಾನು ಚಿರಋಣಿ ಮತ್ತು ನಿಮ್ಮೆಲ್ಲರ ಅಚಲವಾದ ಬೆಂಬಲ ಮತ್ತು ಸಮರ್ಪಣಾ ಮನೋಭಾವ ನಮ್ಮ ಯಶಸ್ವಿಯ ಮೂಲವಾಗಿದೆ ಎಂದು ಹೇಳುವುದರದು ತಪ್ಪಾಗಲಾರದು. ನಮ್ಮ ಧ್ಯೇಯೋದ್ದೇಶಗಳ ಮೇಲಿರುವ ನಿಮ್ಮ ನಂಬಿಕೆ ನಮ್ಮನ್ನು ಇಂದು ಈ ಎತ್ತರಕ್ಕೆ ಬೆಳೆಯಲು ಮತ್ತು ಸಮಾಜದಲ್ಲಿ ಉತ್ತಮ ಬದಲಾವಣೆಗಳನ್ನು ತರಲು ನಮಗೆ ಅವಕಾಶವನ್ನು ಮಾಡಿಕೊಟ್ಟಿದೆ. ಇಂದಿನ ನಮ್ಮ ಈ ಸಮಾರಂಭವು ನಮ್ಮ ಸಾಧನೆಗಳ ಆಚರಣೆ ಮಾತ್ರವಲ್ಲ, ಮಾನಸಿಕ ಆರೋಗ್ಯದ ಪ್ರತಿಪಾದನೆಗೆ ನಮ್ಮೆಲ್ಲರ ಬದ್ಧತೆಯನ್ನು ಪುನರುಚ್ಚರಿಸುವ ಅಮೂಲ್ಯ ಕ್ಷಣವಾಗಿದೆ. ಮಾನಸಿಕ ಆರೋಗ್ಯವು ಮನುಷ್ಯನ ಸರ್ವೋನ್ಮುಖ ಯೋಗಕ್ಷೇಮದ ಒಂದು ಅಗತ್ಯ ಘಟಕವಾಗಿದೆ. ದೈಹಿಕ ಆರೋಗ್ಯವು ನಾವು ನೀಡುವ ಅದೇ ಗಮನ, ಗೌರವ ಮತ್ತು ಸಂಪನ್ಮೂಲಗಳನ್ನು ನಮ್ಮ ಮಾನಸಿಕ ಆರೋಗ್ಯದ ಕಡೆಗೂ ನೀಡಬೇಕೆಂಬುದನ್ನು ನಾವು ನೆನಪಿಸಿಕೊಳ್ಳೋಣ. ನಮ್ಮ ಕೆಲಸವು ಇಷ್ಟಕ್ಕೆ ಇಂದು ಮುಗಿಯುತ್ತಿಲ್ಲ. ನಾವು ಒಟ್ಟಾಗಿ ಮಾನಸಿಕ ಆರೋಗ್ಯದ ಜಾಗೃತಿಯನ್ನು ಮೂಡಿಸುವ ಕಾರ್ಯವನ್ನು ಮುಂದುವರೆಸೋಣ. ಅಗತ್ಯವಿರುವವರನ್ನು ಬೆಂಬಲಿಸೋಣ ಮತ್ತು ವ್ಯವಸ್ಥಿತವಾದ ಬದಲಾವಣೆಯನ್ನು ಪ್ರತಿಪಾದಿಸೋಣ. ನಿಮ್ಮೆಲ್ಲರ ಅಚಂಚಲ ಬೆಂಬಲಕ್ಕಾಗಿ ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ನನ್ನ ಹೃತ್ಪೂರ್ವಕ ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಇಂದು ಇಲ್ಲಿ ನಮ್ಮೆಲ್ಲರ ಉಪಸ್ಥಿತಿಯು ನಿಮ್ಮ ಬದ್ಧತೆ ಹಾಗೂ ಸಾಮಾಜಿಕ ಆರೋಗ್ಯದ ಸಮರ್ಥನೆಯ ಪ್ರಾಮುಖ್ಯತೆಯ ಬಗ್ಗೆ ನಿಮ್ಮ ನಂಬಿಕೆಯನ್ನು ತೋರ್ಪಡಿಸುತ್ತದೆ. ನಾವೆಲ್ಲರೂ ಒಂದಾಗಿ ಪ್ರಪಂಚದಲ್ಲಿ ಹೆಚ್ಚು ಸಹಾನುಭೂತಿ ಮತ್ತು ಬೆಂಬಲವನ್ನು ಸೃಷ್ಟಿಸುವ ಕಡೆಗೆ ಮುನ್ನಡೆಯೋಣ. ಈ ವಿಶೇಷ ದಿನದ ಭಾಗವಾಗಿದ್ದಕ್ಕಾಗಿ ಮತ್ತು ನಮ್ಮ ಧ್ಯೇಯೋದ್ದೇಶಗಳನ್ನು ಈಡೇರಿಸುವಲ್ಲಿ ನಿಮ್ಮ ನಿರಂತರವಾದ ಸಮರ್ಪಣಾ ಮನೋಭಾವ ಹಾಗೂ ಸಹಕಾರಗಳಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ನಾವು ನಮ್ಮ ಇಲ್ಲಿಯವರೆಗಿನ ಸಾಧನೆಗಳನ್ನು ಸಂಭ್ರಮಿಸೋಣ. ನಮ್ಮ ಈ ಪ್ರಯಾಣದಲ್ಲಿ ಇದರ ಭಾಗವಾಗಿರುವ ಎಲ್ಲರನ್ನೂ ಗೌರವಿಸೋಣ ಮತ್ತು ಭವಿಷ್ಯದಲ್ಲಿ ಭರವಸೆ ಮತ್ತು ಉತ್ತಮ ನಿರ್ಣಯಗಳನ್ನು ಎದುರು ನೋಡೋಣ. ಮತ್ತೊಮ್ಮೆ ಟ್ರೇಡಾ ಮಾನಸಿಕ ಆರೋಗ್ಯ ಮತ್ತು ಕ್ಷೇಮ ಸಂಸ್ಥೆಯ 31ನೆಯ ಸಂಸ್ಥಾನ ದಿನಾಚರಣೆಗೆ ಎಲ್ಲರಿಗೂ ಸ್ವಾಗತವನ್ನು ಬಯಸುತ್ತಾ ನಮ್ಮ ಇಂದಿನ ದಿನವನ್ನು ಅವಿಸ್ಮರಣೀಯ ದಿನವನ್ನಾಗಿ ಮಾರ್ಪಡಿಸೋಣ ಎನ್ನುತ್ತಾ ನಮ್ಮ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಮುಖ್ಯ ಅತಿಥಿಗಳಾಗಿ ಆಗಮಿಸಿರುವಂಥ ಹಾನರೇಬಲ್ ಸ್ಪೀಕರ್ ಕರ್ನಾಟಕ ಲೆಜಿಸ್ಲೇಟಿವ್ ಅಸೆಂಬ್ಲಿ ಶ್ರೀ UT ಖಾದರ್ ಅವರಿಗೆ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇನೆ. ವೆಲ್ಕಮ್ ಸರ್. ಹಾಗೆ ಈ ಸುದಿನದಲ್ಲಿ ನಮ್ಮೊಂದಿಗೆ ಪಾಲ್ಗೊಳ್ಳಲು ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಆಗಮಿಸಿರುವಂತಹ ಹಾನರಬಲ್ ಚೀಫ್ ವಿಪ್ ಶ್ರೀ ಸಲೀಂ ಅಹಮದ್ ಅವರಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ಹಾಗೆ ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಬಂದಿರುವಂತಹ KPCC ಕೋಆರ್ಡಿನೇಟರ್ ಶ್ರೀ ಶಾಜಿ ಚೋರ್ಸ್ ಅವರಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ಈ ದಿನದ ಸಂತೋಷದಲ್ಲಿ ಪಾಲ್ಗೊಳ್ಳಲು ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಆಗಮಿಸಿರುವಂತಹ ಫಾದರ್ ಜೋಸ್ ಕಣ್ಣಂದಾನಂ, ದ ಡೈರೆಕ್ಟರ್ ಆಫ್ ಸುಮ್ಮನಹಳ್ಳಿ ಲೆಪ್ರಸಿ ಸೆಂಟರ್, ಹಲವಾರು ಸಮಾಜ ಕಲ್ಯಾಣ ಕಾರ್ಯಕ್ರಮಗಳಲ್ಲಿ ತಮ್ಮನ್ನು ತಾನೇ ತೊಡಗಿಸಿರುತ್ತಾರೆ. ಅವರಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇನೆ. ಹಾಗೆ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವಂತಹ ಶ್ರೀ UT ಸುಫೀಕರ್ ಅಲಿ ಅವರಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ಹಾಗೆ ದ ಡೈರೆಕ್ಟರ್ ಆಫ್ ನೇಟರ್ಸ್ ಹಾಸ್ಪಿಟಲ್ ಶ್ರೀ ಜೋಬಿ ಜಾನ್ ಅವರಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವಂತಹ ನಮ್ಮ ಕರ್ಮಲ್ರಾಮ್ ಫರೋನಾ ಚರ್ಚ್ನ ಫಾದರ್ ಬಿಗಾರ್, ಫಾದರ್ ಮಾರ್ಕ್ ಅವರಿಗೂ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಆಗಮಿಸಿರುವಂತಹ ಬಿಗಾರ್ ಫಾದರ್ ರಾಜೇಶ್ ಅವರಿದ್ದಾರೆ. ಮತ್ತೆಲ್ಲ ಉಳಿದಿರುವಂಥ ಎಲ್ಲ ಫಾದರ್ಸ್ನವರಿಗೂ ಸಿಸ್ಟರ್ಸ್ನವರಿಗೂ ಹಾಗೂ ನಮ್ಮ ಆಮಂತ್ರಣವನ್ನು ಸ್ವೀಕರಿಸಿ ಬಂದಿರುವಂಥ ಗಣ್ಯ ವ್ಯಕ್ತಿಗಳಿಗೂ, ಸ್ವಯಂ ಸೇವಕ ಹಾಗೂ ನಮ್ಮ ಪಾಲುದಾರರಾದ ಸಂಸ್ಥೆಗಳಿಂದ ಬಂದಿರುವಂತಹ ಎಲ್ಲ ಗಣ್ಯ ವ್ಯಕ್ತಿಗಳಿಗೂ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಪರವಾಗಿ ಹಾಗೂ ಇಲ್ಲಿರುವ ಎಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇವೆ. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವಂಥ ಎಲ್ಲ ಸಿಬ್ಬಂದಿ ವರ್ಗದವರಿಗೂ, ಮಾಧ್ಯಮದ ವರ್ಗದವರಿಗೂ, ಇಲ್ಲಿ ಆಗಮಿಸಿರುವಂತಹ ಸಹೋದರ ಸಹೋದರಿಯರಿಗೂ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತಾ ಮತ್ತೊಮ್ಮೆ ಮಗದೊಮ್ಮೆ ಎಲ್ಲರಿಗೂ ಹೃತ್ಪೂರ್ವಕ ಸ್ವಾಗತ, ಸುಸ್ವಾಗತ. ಥ್ಯಾಂಕ್ ಯು.
Thank you for sharing your precious words with us, sir. Thank you.
I'm now privileged to have with us our guest of honor, Shri UT Khadar, Speaker of the Karnataka Legislative Assembly, Honorable Speaker of the Karnataka Legislative Assembly, MLA Mangaluru, former Health and Food and Civil Supplies, Urban and Housing Minister, who represents dedication, integrity and leadership in Karnataka's legislative affairs. Shri UT Khadar, who has been a solid personality in Karnataka's political landscape, guiding the legislative process with a steadfast commitment to democracy and effective governance. Ladies and gentlemen, please give a big round of applause to welcome Shri UT Khadar on the stage to speak a few words for us. Thank you, sir.
Chairman of today's function, Managing Director of TREDA, Reverend Father Sinton Matthew, the guests on the dais, Chief Whip of Karnataka Legislative Council, our senior leader, Sri Salim Ahmed ji, guests on the dais, Father Mark, Father George, Director of Natas Hospital, Sri Jobin John, Dr. Lingaraju, our friend Sri Shaji George and UT Zulfikar Ali, and all the guests on the dais, dignitaries of the dais, faculty and the staff members of various hospitals and nursing colleges, all the nurses who are under training or in the internship or in the final year, and all the students who are gathered over here. I hope all can understand Kannada. Ellarigu Kannada bartada? Illa? ಎಷ್ಟು ಜನಕ್ಕೆ ಬರೋದಿಲ್ಲ? ಕೈ ಎತ್ತಿ ನೋಡುವ. No problem. Before completing your course, learn Kannada. Because language is very important. ನೀವು ಇಲ್ಲಿ ಕನ್ನಡ ಗೊತ್ತಿಲ್ಲದೆ ನಿಮ್ಮ ಹತ್ರ ಪೇಷಂಟ್ಗೆ ಬಂದು ನನಗೆ ತಲೆನೋವು ಅಂತ ನೀವು ಕಾಲು ನೋವು ಅಂತ ಮದ್ದು ಕೊಟ್ಟ ಪರಿಸ್ಥಿತಿ ಏನಾಗ್ಬೋದು ಇಲ್ಲಿ ಅಲ್ವಾ? ಅದಕ್ಕೆ ನೀವು ಕರೆಕ್ಟಾಗಿ ನೀವು ಅಲ್ಲಿ ಹೋಗಿ ನಿಮ್ಮ ಕರ್ನಾಟಕದಲ್ಲಿ ಜಾಬ್ ಮಾಡ್ತೀರಾ, ಕೇರಳದಲ್ಲಿ ಮಾಡ್ತೀರಾ, ಅಥವಾ ಹಿಂದಿ ನೀವು ನಾರ್ತ್ ಇಂಡಿಯಾ ಮಾಡ್ತೀರಾ, ಫಾರಿನಲ್ಲಿ ಮಾಡ್ತೀರಾ ಗೊತ್ತಿಲ್ಲ. ಅದಕ್ಕೆ ಆಲ್ ದಿಸ್ ಲ್ಯಾಂಗ್ವೇಜಸ್, ರೀಜನಲ್ ಲ್ಯಾಂಗ್ವೇಜ್, ನ್ಯಾಷನಲ್ ಲ್ಯಾಂಗ್ವೇಜ್, ಇಂಟರ್ನ್ಯಾಷನಲ್ ಲ್ಯಾಂಗ್ವೇಜ್, ಎಷ್ಟು ಲ್ಯಾಂಗ್ವೇಜ್ ನಿಮಗೆ ಕಲೀಲಿಕ್ಕೆ ಆಗ್ತದೆ ಅಷ್ಟು ಲ್ಯಾಂಗ್ವೇಜನ್ನು ಕಲಿಯುವಂಥ ಮನೋಭಾವ ಅಂತೆಲ್ಲ ಇವತ್ತು ಹಮ್ಮಿಕೊಳ್ಬೇಕು. ದ್ಯಾಟ್ ವಿಲ್ ಬಿಲ್ಡ್ ಯುವರ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಇನ್ ದಿ ಪ್ರೊಫೆಷನ್, ಐ ಲೈಕ್ ಟು ಸೇ. ಅದಾಗ ನಾನು ನಿಮಗೆಲ್ಲ ಶುಭಾಶಯ ಸಲ್ಲಿಸ್ತೇನೆ. ನಾನು ಪ್ರಪ್ರಥಮವಾಗಿ ಈ ಒಂದು ಸಂಸ್ಥೆಯನ್ನು ಇದು 31ನೇ ಫೌಂಡರ್ಸ್ ಡೇ ಸೆರೆಮನಿ. ನಾನು ಬಹುಶಃ ಇವತ್ತು 31st ಇಯರ್ನಿಂದ ಹಿಂದೆ ಪ್ರಾರಂಭ ಮಾಡಿದಂಥ ಸಿರ್ಸನ್ ಲಿಲ್ಲಿ ಸಿಸ್ಟರನ್ನು ಮತ್ತು ಅವ್ರಿಗೆ ಸಹಕಾರ ಕೊಟ್ಟಂತಹ ಪ್ರತಿಯೊಬ್ಬರೂ ಕೂಡ ನಾವೆಲ್ಲದ್ದು ನೆನೆಸ್ಕೊಳ್ಬೇಕಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸ್ತೇನೆ. 30 ವರ್ಷಗಳ ಹಿಂದೆ ಈ ಒಂದು ಪ್ರದೇಶಕ್ಕೆ ಬಂದು ಬಹುಶಃ ಅವರಿಗೆ ಸಹಕಾರ ಕೊಟ್ಟಂಥ ಈ ಕಾರ್ಮಲೈಟ್ ಸಂಸ್ಥೆ ಅವತ್ತಿನ ಇವರು 60 ವರ್ಷ ಹಿಂದೆ ಬಂದಿದ್ದಾರೆ ಇಲ್ಲಿಗೆ. ಈಗವೇ ನೀವು ಬೆಂಗಳೂರಿನಲ್ಲಿ ಕೇಳಿದರೆ ಅಲ್ಲಿ ನೀರಿಲ್ಲ, ಇಲ್ಲಿ ಲೈಟ್ ಇಲ್ಲ, ಇಲ್ಲಿ ತೋಡಿಲ್ಲ, ಚರಂಡಿ ಇಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. 31 ವರ್ಷಗಳಿಂದ ಇಲ್ಲಿ ಏನು ಮೂಲಭೂತ ಸೌಕರ್ಯ ಇರಲಿಕ್ಕೆ ಇಲ್ಲ. ಎಷ್ಟೇ ಕಷ್ಟ ಆದರೂ ಕೂಡ ನಾವಿಲ್ಲಿ ಬಂದು ನೊಂದ ಜನರ ಕಣ್ಣೀರನ್ನು ಒರೆಸಬೇಕು. ನಾವು ಬಹುಶಃ ಸಮಾನತೆ ಮಾನವೀಯತೆಗೆ ಒತ್ತು ಕೊಡಬೇಕು. ಯಾರು ಕಷ್ಟದಲ್ಲಿದ್ದವರಿಗೆಲ್ಲ ಸಹಕಾರ ಕೊಡಬೇಕು. ಅವತ್ತಿನ ಕಾಲದಲ್ಲಿ ಯಾರು ಕೂಡ ಆಲೋಚನೆ ಮಾಡಿದಂತಹ ಟ್ರೈನಿಂಗ್ ಮತ್ತು ಡ್ರಗ್ ಅಬ್ಯೂಸ್ ಮತ್ತು ಅಡಿಕ್ಷನ್ ಮತ್ತು ಎಲ್ಲ ಕೂಡ ಅವತ್ತಿನ ಕಾಲ ಆಲೋಚನೆ ಮಾಡಿ ಆ ಸಂಸ್ಥೆಯನ್ನು ಪ್ರಾರಂಭ ಮಾಡಿದಾರಲ್ಲ, ಇವನ್ನೆಲ್ಲ ಕೂಡ ನೆನಪಿಸಿಕೊಂಡು ಅವ್ರನ್ನ ಸ್ಮರಿಸಿದ್ದು ನಮ್ಮೆಲ್ಲರೂ ಕೂಡ ಇವತ್ತು ಕರ್ತವ್ಯ ಅಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸ್ತೇನೆ. ಈ ಒಂದು ಫೌಂಡೇಶನ್ ಡೇ ದಿವಸ ಇದನ್ನು ಪ್ರಾರಂಭ ಮಾಡಿದಂಥ ಸಿಸ್ಟರ್ ಲಿಲ್ಲಿ ಸಿಸ್ಟರ್ ನೀವು ನೆನಪು ಮಾಡೋದು ಮಾತ್ರ ಅಲ್ಲ, ನೀವೆಲ್ಲರೂ ಕೂಡ ಅದೇ ರೀತಿ ಆಗಬೇಕೆಂಬ ದೊಡ್ಡ ಮಟ್ಟದ ಛಲವನ್ನು ಕೂಡ ಹಮ್ಮಿಕೊಳ್ಬೇಕಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸುವಂಥದ್ದು. ಯಾವುದೇ ಪ್ರದೇಶಕ್ಕೆ ಹೋದರೂ ಕೂಡ ಸರ್ವರ ಪ್ರೀತಿಗೆ ಪಾತ್ರರಾಗಿ ತಮ್ಮ ಆ ಪ್ರೊಫೆಷನನ್ನು ಅತ್ಯುತ್ತಮವಾಗಿ ನಿರ್ವಹಿಸಿಕೊಂಡು ಒಂದು ಉತ್ತಮವಾದ ಆ ಒಂದು ನರ್ಸಸ್ ಆಗಿ ತಾವು ಬರಬೇಕಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸ್ತೇನೆ. ಬಹುಶಃ ನಾನಿವತ್ತು ನಮ್ಮ ಈ ಒಂದು ಸಂಸ್ಥೆಯಲ್ಲಿ ಕಾರ್ಯಕ್ರಮ ಹಮ್ಮಿಕೊಳ್ಳದಂಥ ಫಾದರ್ ಶಿಂದು ಮ್ಯಾಥ್ಯೂ ಇರಲಿ, ಫಾದರ್ ಜಾರ್ಜ್ ಇರಲಿ, ಇನ್ನಿತ ಎಲ್ಲ ಸಂಘಟಕರನ್ನು ಮೊನ್ನೆ ಬಂದಾಗ ನಾನು ಕೇಳಿದೆ. ಅವರು ಹೇಳಿದರು, ವಿ ವಾಂಟ್ ಟು ಅಪ್ಡೇಟ್ ದಿ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಂತ್ ಆ್ಯಂಡ್ ದ ಪರ್ಸನಾಲಿಟಿ ಆಫ್ ದಿ ನರ್ಸಸ್ ಪ್ರೊಫೆಷನ್ ಮಾಡ್ತಾರೆ, ಅವ್ರನ್ನ ಅಪ್ಡೇಟ್ ಮಾಡಲಿಕ್ಕೆ ನಾವು ಈ ರೀತಿಯ ಒಂದು ಟ್ರೈನಿಂಗನ್ನು ಕಂಡಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಒಂದು ಫೌಂಡರ್ಸ್ ಡೇ ಎಂಬ ಅತ್ಯುತ್ತಮವಾದ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಹಮ್ಮಿಕೊಂಡಿದ್ದಾರೆ. ಇಟ್ ಈಸ್ ವೆರಿ ಎಸೆನ್ಷಿಯಲ್ ಟು ಅಪ್ಡೇಟ್ ಆ್ಯಂಡ್ ಹ್ಯಾವ್ ಅ ನೆಟ್ವರ್ಕ್ ಆಫ್ ಪ್ರೊಫೆಷನಲ್ nurses and update your knowledge and share your experience which will benefit the patients in the days to come. Concerning the mental training for your confidence is not only necessary for you, for us also it's necessary. ಯಾಕೆಂತ ಹೇಳಿದರೆ ಎಲ್ಲರಿಗೂ ಕೂಡ ಇವತ್ತು ಮೆಂಟಲಿಗೆ ಸಂಬಂಧಪಟ್ಟಾಗಿ ದೊಡ್ಡ ಟ್ರೈನಿಂಗ್ ಅಗತ್ಯ. ಯಾಕಂತ ಹೇಳಿದರೆ ಎಲ್ಲ ಜನರು ಕೂಡ 5% ಕಮ್ಮಿ, ಈಗ 100% ಫುಲ್ ಯಾರು ಕೂಡ ಇರುವುದಿಲ್ಲ. ಒಂದಲ್ಲ ವೃತ್ತಿಯಿಂದ ಅವರಿಗೆ 5% ಆಲ್ ಆರ್ ಲೆಸ್ ಓನ್ಲಿ. So in the training will fulfill that 5%, whatever that negativity is there, that will fulfill up. ಆದ ಕಾರಣ ಇವತ್ತು ನಿಮಗೆ ನಿಮ್ಮ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಇರಲಿ, ನಿಮ್ಮ ಕಾನ್ಫಿಡೆನ್ಸ್ ಬಿಲ್ಡ್ ಮಾಡಬೇಕು ಹೇಗಿರಲಿ, ಆಲ್ ದಿಸ್ ಟ್ರೈನಿಂಗ್ಸ್ ಆರ್ ಗಿವನ್ ಫಾರ್ ಯು ಬೈ ದ ಒನ್ ಆಫ್ ದ ಪ್ರೊಫೆಷನಲ್ಸ್. ದೇ ಆರ್ ಸಮ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ಆ್ಯಂಡ್ ದೇ ಗಿವ್ ದ ಟ್ರೈನಿಂಗ್. ಐ ಥಿಂಕ್ ದ ಬೆಸ್ಟ್, ಐ ಆಲ್ವೇಸ್ ಸೇ, a hospital can run without a doctor, but not without nurses ಅಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸ್ತೇನೆ. So your role is very much important, not to run the hospital, in the curing the patient also. The doctor may come one day or twice a day to see the patients, take a round and go for 5 or 10 minutes. Ultimately, with the patient, it are the nurses who come in the early morning, in the mid-afternoon, again in the evening, and again night. And they are the people who give the confidence along with the medicine to the patients who are there. Ultimately, a good nurse can manage entire patient's, I think, health. So I think your professionalism to improve is very good. So first you should be calm mind, without tension, free of mind, and that confidence you should have. Then only you can go and give the treatment. If you only go with the tension, seeing your face, the patient has been full tension, and the medicine doesn't work. Whatever the medicine is given to a patient, if that should work to his body, that patient should be in a calm mind. That is very much important. Because the cells in the body has to take the medicine what is given, and that only will cure the patient's sickness. So all these trainings are given for you all to update yourself. ಅದಕ್ಕೆ ತಾವೆಲ್ಲ ಇದು ನಿಮ್ಮ ಒಂದು ಮಹತ್ವದ ಜವಾಬ್ದಾರಿ ಇವತ್ತು ನಿಮಗೆಲ್ಲರಿಗೂ ಕೂಡ ಇರುವಂಥ ಅವಕಾಶ ಕೂಡ ಇವತ್ತು ಆಗ್ತದೆ. ಅದಕ್ಕಾಗಿ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಮೀನ್ಸ್ ಬ್ಯಾಲೆನ್ಸಿಂಗ್ ಯುವರ್ ಮೈಂಡ್ ಈಸ್ ಓನ್ಲಿ ಅ ಮೆಂಟಲ್ ಹೆಲ್ತ್, ಆ್ಯಂಡ್ ಇಸ್ ಬಿಕಾಸ್ ವಿ ವಾಂಟ್ ಎವ್ರಿ ಒನ್ ಟು ಬ್ಯಾಲೆನ್ಸ್ ಅವರ್ ಮೈಂಡ್. ಇನ್ ಸೊಸೈಟಿ, ಇನ್ ಅವರ್ ಡೇ ಟು ಲೈಫ್, we can't expect whatever you want to come. Today we think one thing, happens another thing. When that happens, we shouldn't lose our calmness, we shouldn't lose our tension, or we should, the balance of the mind shouldn't go because of the incident what has taken place. Let whatever incident comes, let whatever problem comes, or whatever issues come, you should see that how we are calm and quiet and balanced with patience. And with your patient, with the ತಾಳ್ಮೆ ಕೂಡ ಅದಕ್ಕೆ ಅತಿ ಅಗತ್ಯ ಅಂತ ಹೇಳಲಿಕ್ಕೆ ನಾನು ಇವತ್ತು ಬಯಸುವಂಥದ್ದು. ಇವತ್ತಿನ ಎಲ್ಲ ಸಮಸ್ಯೆಗೆ ದ ಮೇನ್ ಪ್ರಾಬ್ಲಮ್ ಟುಡೇ ಇನ್ ಸೊಸೈಟಿ ದ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಆಫ್ ಮೈಂಡ್. ಮೈಂಡ್ ಬ್ಯಾಲೆನ್ಸ್ ಇಲ್ಲ. ಯಾರಾದರೂ, ಐ ಆಲ್ವೇಸ್ ಸೇ, ಯು ಹ್ಯಾವ್ ಟು ಕಂಟ್ರೋಲ್ ಯುವರ್ ಸೆಲ್ಫ್. ನೋ ಒನ್ ಅದರ್ ಪರ್ಸನ್ ಕಾಂಟ್ ಕಂಟ್ರೋಲ್ ಯು. ಯಾಕಂತ ಹೇಳಿದರೆ, ಇಫ್ ಅನದರ್ ಪರ್ಸನ್ ಪ್ರೇಸಸ್ ಮೀ, ಐ ವಿಲ್ ಬಿ ವೆರಿ ಹ್ಯಾಪಿ. ಇಫ್ ಹಿ ಅಬ್ಯೂಸಸ್ ಮೀ, ಐ ಆಮ್ ವೆರಿ angry. That shows I am not controlling myself. The person who is abusing and praising, they are controlling me. We should see that we control ourselves. Let other people tell anything good or bad is not concern. What you are is more concern. According to that, you have to do your life and your profession. That is very important. And anxiety also. Suddenly we get angry. Now it's a bigger fast food. All fast food only. Urgent. No time for patience at all. If one fellow tell one thing, immediately reply will come twice from this side. No one has the patience to accept and absorb the abuse or absorb the situation, calm down, then take action according to that. These all things are necessary for all the nursing profession who are running who are the main to run the hospitals and our healthy society in days to come. Concerning the drug abuse and other things also are very much needed in the society. I request all the nursing who are there, when you are in a profession, be a good nurse, give the treatment correctly. Along with that, you have to be a person who will preventive measures also. You have to advise a patient how to prevent, and their family members, not only take them how the medicine to take the medicine, on preventive measures also. What their lifestyle should be there, and how their environment should be there, and what is the food habit they should takes place. And advice to them also will see that much of the patients coming for sickness will be prevented. So preventive measures, awareness also is needed from you all. We politicians, if we tell something, people won't listen. They tell this talk always politics. But when doctors and nurses tell something, the people and the common man, really they'll take into their mind and heart, and they will follow what they all say. That also your capacity as an individual is very much needed for this society. And I always say, nurses, please give time, because doctor can't give time. The nurses have to give time to the patients who have come to the hospital. I was a health minister. I have seen a long time, a lot of issues takes place in the hospital. Mostly by one patients, one family, there will be one type. And all will be in anxiety and tension. What happens to my mother, what happens to my father or my children? Or the doctor comes, he sees and goes, he doesn't talk to the patient's party at all. He is busy in another patient, another hospital. He'll just tell you, see and go. When this come to the nurse session, I don't know, you talk to the doctor. When they ask the phone number of I don't know, we can't give the phone number. This patient doesn't know whom to talk, whom to contact, there will be more anxiety. Unfortunately, something happens and that patient died. All this anger will be taken on the hospital and the doctors and the nurses, because not that you are not treated, you are not given time for them to express, and you express them what is happening. If the doctor and nurses sits and explain them this, they will tell. Even everyone knows, doctor and nurses can't save your own father and mother or own your relation. Doctors and nurses all the time can't save your own children or your parents. Even the people know that. But convincing them is very important. If you talk to them nicely, if you explain them, the last minute they'll take. The doctor and nurses, they've struggled a lot, they've tried a lot, what to do? Destiny is like, we couldn't save him. See, this is very important within the hospital, the nurses, doctors and the patients for the good environment in the days to come. So, from morning you all are in this class only. So again, I don't want to tell all these things to again. You may be thinking, from morning we are tired of listening. Again, it's certain we to listen 1 hour all these things. I know you are more capable and more knowledgeable than hers also. Concerning the Carmelite institution, concerning the TREDA, I have nothing to say. But we have to learn a lot from you all, I'd like to say. Even we have to learn a lot from you, and you see that we both joined to the government and the TREDA institution or NGOs like TREDA or Carmelite join together, have a common agenda, and will help the poor in whatever way it is possible. I always say that representatives and government can't go and stand in front of everyone's house and solve the problem. The best thing is we can support some institution and they will support the people. Indirectly, the people will get the benefit in the society and in this state. So once again, I congratulate each and everyone and all your parents who have struggled and were made for this level of nursing students and nurses and all the chairmen and faculty members of the colleges where you have studied and who have taught you also, so that all their knowledge is transferred to you. Now your duty is work hard, transfer your knowledge to the younger generation in the society in the days to come. And I wish, and this Carmelite institutions, this program is one of the most useful program to the society. Ultimately, all your whatever knowledge you are given to these people, they won't keep it. Tomorrow they will render the service to the people in this society. So in future also, you do such good things, get to our notice also, and please guide us and the government how we can improve the health sector in the society, and concerning the concerning the drug abuse and concerning de-addiction issues also, how more and more action can be taken. So thanking each and everyone, thanking all the students and the nurses who have joined over here, and thanking the Carmelite and the TREDA Foundation, TREDA Institute, Health and Wellness Center. So thank you, Namaskar, Jai Hind.
Thank you for sharing your wise words with us, sir. We are really delighted. I am now again delighted to be introducing Shri Salim Ahmed, Member of Karnataka Legislative Council, Honorable Chief Whip, Government of Karnataka, former AICC Secretary, Working President, KPCC, DG NYKS, Government of India, LYC and National President, NSUI, respected member of the Karnataka Legislative Council. Shri Salim Ahmed brings a wealth of Shri Salim Ahmed brings a wealth of experience and a deep commitment to public service, representing his constituency with dedication and vision. Ladies and gentlemen, give a huge round of applause as we welcome Shri Salim Ahmed on stage to share a few words.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ 31ನೇ ವರ್ಷದ ವಾರ್ಷಿಕೋತ್ಸವದ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಉದ್ಘಾಟನೆ ಮಾಡಿದಂತಹ ವಿಧಾನಸಭೆಯ ಅಧ್ಯಕ್ಷರಾದ ಸನ್ಮಾನ್ಯ ಯು ಟಿ ಖಾದರ್ ಅವರೇ, ಶಾಜಿ ಜಾರ್ಜ್ ರವರೇ, ಜುಲ್ಫಿಕಾರ್ ರವರೇ, ಫಾದರ್ ಶಿಂಟೋ ಮ್ಯಾಥ್ಯೂ ರವರೇ, ಜಾನ್ ಜಾಬಿನ್ ರವರೇ, ಫಾದರ್ ವೆಬ್ಲಿನ್ ರವರೇ, ಮಾಲಕ್ ರವರೇ, ಜಾರ್ಜ್ ರವರೇ, ಸಿಮ್ರನ್ ಲಿಲ್ಲಿ ಅವರೇ, ಈ ಸಂಸ್ಥೆಯ ಎಲ್ಲ ಪದಾಧಿಕಾರಿಗಳೇ, ಇಲ್ಲಿ ಬಂದಂತಹ ವಿದ್ಯಾರ್ಥಿನಿಯರೇ, ಅಧಿಕಾರ ವರ್ಗದವರೇ ಹಾಗೂ ಸ್ನೇಹಿತರೆ, ಬಹುಶಃ ಊಟ ಬಂದಾದ್ಮೇಲೆ ಸ್ವಲ್ಪ ನಿದ್ದೆ ಬರ್ತಾ ಇದೆ ಕಾಣ್ತಾ ಇದೆ. ಐ ಆಮ್ ಸೀಯಿಂಗ್ ಸಮ್ ಆಫ್ ದ ಸ್ಟೂಡೆಂಟ್ಸ್ yawning also. I will not take much of your time. ನಾನು ಜಾಸ್ತಿ ಸಮಯ ತಗೊಳ್ಳೋಕೆ ಹೋಗೋದಿಲ್ಲ. ಈಗಾಗಲೇ ಸನ್ಮಾನ್ಯ ಸ್ಪೀಕರ್ ಖಾದರ್ ಅವರು ಸವಿಸ್ತಾರವಾಗಿ ನಿಮ್ಮ ಜವಾಬ್ದಾರಿಗಳು, ನಮ್ಮ ಹೊಣೆಗಾರಿಕೆ ಎಲ್ಲ ವಿಚಾರಗಳನ್ನು ಹೇಳಿದ್ದಾರೆ. ಮೊಟ್ಟ ಮೊದಲಾಗಿ ಟ್ರೇಡಾ ಸಂಸ್ಥೆಯ ಎಲ್ಲ ಪದಾಧಿಕಾರಿಗಳಿಗೆ, ಎಲ್ಲ ಅಧಿಕಾರ ವರ್ಗದವ್ರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು, ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೇನೆ. ಇಡೀ ದಕ್ಷಿಣ ಭಾರತದ ಹಲವಾರು ರಾಜ್ಯಗಳಿಂದ ಬಂದಂತಹ ಏನು ವಿದ್ಯಾರ್ಥಿಗಳನ್ನ ಇವತ್ತು ನಾವು ಭೇಟಿ ಮಾಡಿದ್ದೀವಿ, ಅದರ ಮೂಲಕ ಒಂದು ದೊಡ್ಡ ಒಂದು ಕಾರ್ಯಕ್ರಮ ತಾವು ರೂಪಣೆ ಮಾಡಿದ್ದೀರ. ಫಾಸ್ಟ್ರಿಂಗ್ ಪಾಸಿಟಿವ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಅಂಡ್ ಫಾರ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಅಂತ ಈಗಾಗಲೇ ಅವರು ಮಾಹಿತಿ ಕೊಟ್ಟರು. ಹಲವಾರು ಕಾರ್ಯಕ್ರಮ, ವಿಶೇಷವಾಗಿ ಈ ಡ್ರಗ್ ಅಬ್ಯೂಸ್ ಏನಾಗಿದ್ದಾರೆ ಯುವಕರು, ಅವರ ಒಂದು ಕ್ಯಾಂಪ್ ಕೂಡ ಮಾಡಿ ಅವರಿಗೆ ಅದು ಬಿಡೋ ರೀತಿಯಲ್ಲಿ ನಾವು ಪ್ರೋಗ್ರಾಮ್ಗಳನ್ನ ಹಾಕ್ಕೊಳ್ತಾ ಇದ್ದೀವಿ ಅನ್ನೋದು ಮಾತನ್ನು ಕೂಡ ಹೇಳಿದ್ದಾರೆ. ಅದೇ ರೀತಿ ಸಾಮಾಜಿಕ ಹಲವಾರು ಪಿಡುಗುಗಳ ವಿರುದ್ಧ ಹೋರಾಟ ಮಾಡಿದಂತಹ ಈ ಟ್ರೇಡಾ ಸಂಸ್ಥೆ ನಿಜವಾಗ್ಲೂ ಒಂದು ಒಳ್ಳೆಯ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ. ನನ್ನ ಪರವಾಗಿ ಹಾಗೂ ಕರ್ನಾಟಕ ಸರ್ಕಾರದ ಪರವಾಗಿ ಅವ್ರಿಗೆ ಧನ್ಯವಾದ, ಅಭಿನಂದನೆಗಳನ್ನು ಸಲ್ಲಿಸ್ತಾ ಇದ್ದೇನೆ. The most important component of the body is mind. If mind fails, everything fails. People say if you control your mind, you can control everybody. You can control everything. You have big responsibility. Your pleasing personality, smiling face would definitely help patients. You have commitment, you have dedication. Doctors have their role, but you have a very important role to play. To take care. As like the speaker said, you should have patience. That is the most important thing in your career. With this program, I think you had deliberations in the morning also. I would not like to take much time of yours, because listen to speeches are boring, I feel. But I would like to tell you, you have big responsibility to play in the future days. So I'm very happy today, especially our friend Shaji, who was very concerned that we should all attend this program, whether it is speaker or myself. There have been, because this program was fixed on 8th of last month, speaker and ourselves, we had gone to America to attend a conference. So this date was again changed. And today we are very happy to participate in your seminar. Whatever time you are spending here should be productive. You should learn a lot of things and you should deliver a lot of things. ಮತ್ತೆ ನಾನು ಹೆಚ್ಚಾಗಿ ಮಾತಾಡದೆ ಈ ಸಂಸ್ಥೆಗೆ ಶುಭಾಶಯ ಕೋರ್ತೇನೆ. ನಿಮ್ಮ ಪರವಾಗಿ ನಾವು ಇದ್ದೇವೆ. ಇವತ್ತು ಏನು ತಾವು ಕಾರ್ಯಕ್ರಮ ಹಾಕ್ಕೊಂಡು ಒಂದು ಒಳ್ಳೆ ಕೆಲಸ ತಾವು ಮಾಡ್ತಾ ಇದ್ದೀರಾ, ಅದಕ್ಕೆ ತಮಗೆ ಸಂಪೂರ್ಣ ಬೆಂಬಲವನ್ನು ವ್ಯಕ್ತಪಡಿಸ್ತಾ ಈ ಸಂಸ್ಥೆ ಹೆಚ್ಚು ಹೆಚ್ಚು ಬೆಳೀಲಿ, ಸಮಾಜಕ್ಕೆ, ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ, ಜನರಿಗೆ ಇನ್ನು ಹೆಚ್ಚು ಉಪಕಾರ ಆಗಲಿ, ಇನ್ನು ಹೆಚ್ಚು ಕೆಲಸ ಮಾಡಲಿ ಅಂತ ಶುಭವನ್ನು ಕೋರ್ತಾ ನನ್ನ 2 ಮಾತುಗಳನ್ನು ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ನಮಸ್ಕಾರ.
Thank you so much, sir, for your insightful thoughts with us. We now start our award ceremony. It is my distinct honor and pleasure to introduce our champion of compassion and advocate of the abandoned people, introducing Sister Lily Chunkapura, MMS, who was a member of the International Society of Catholic Medical Mission Sisters. As we gather here to celebrate this felicitating ceremony, we are privileged to honor her. Her life's work embodies the spirit of compassion, innovation, and unwavering dedication.
Here are a few words about Sister Lily Chunkapura. Our revolutionary woman, Sister Lily Chunkapura, a remarkable personality whose influence in the field of social work has left an indelible mark on our society. As the founder of TREDA Institute of Mental Health and Wellness, Sister Lily has demonstrated extraordinary leadership and vision, championing the cause of mental health, community support, women empowerment, free medical camps, financial support for education, leader for marginalized community, child welfare, zero hunger initiator, and the list goes high. With a career spanning over 28 years, Sister Lily was always at the forefront of social change, advocating for vulnerable populations and directing initiatives that have transformed countless lives. She is really an exceptional testimony to the effort she's made in the society. Hence today we have the honor of recognizing one of our very own who exemplifies these qualities in extraordinary ways. So, ladies and gentlemen, we pay tribute to remarkable Sister Lily with an honor of Sister Lily Chunkapura Award, which is a special accolade that acknowledges outstanding contributions in the realm of social work.
This award is presented for the first time to Father George Kanandanam, who has demonstrated exceptional commitment, innovation, and impact in his role, and whose work has truly made a significant difference in the lives of those served. Father George Kanandanam is a Catholic priest and activist, also known as the heart of social work and soul of the service. He has been involved with various social programs for the marginalized groups since 35 years. He founded the Hope Society in 1988 to work among alcoholics and drug addicts. He is living with the leprosy-affected persons at the Sumanhalli Center, Bangalore for 15 years. He initiated support centers in Bengaluru and Belgaum to provide HIV-affected destitute persons care and rehabilitation. He has been involved effectively with the disaster management programs for tsunami, earthquake in Nepal, floods in Kerala, and COVID-19. He started a project Vision to support the visually challenged people, Mother's Meal to feed the hungry, and Project Shelter to provide shelter for the homeless. With a master's in social work and doctorate in sociology, Father George has written the book named The Empty Nest on the rehabilitation model for leprosy. He was conferred the National Award from the Government of India, which was received from President Abdul Kalam in 2003, Mother Teresa Award in 2012, and the Best Citizen of Bengaluru Award in 2013, and Excellence in Social Work Award in 2019, and National Integration Award in 2023. We would like to felicitate you, Father, with this honorable award today. A huge round of applause for Father George.
In a classroom, there was a teacher who gave an exercise to the students. The students were asked to write, what is it that you want to become?
Can we please request all
Of
you
course,
to
that-
rise in your seats? Thank you.
Oh, he called the student and told the student, I don't think you understood my question. Then
A big
the
round of
student
applause for
told
Father George.
The teacher, I think you did not understand what is life.
He's truly an inspiration for all of us here.
So, my dear friends, I'm sure all of us must really be happy about this answer of the student, isn't it? What are we living for? We all would like to be happy in life, and that is the purpose of life.
Father George,
Of course, we can have different discussions on how to be happy, how to find that happiness. From my
Father George, may we please request you to say a few words for us so we can follow your footsteps. Thank you.
Thank you all for your appreciation of my work. Sister Lily, the founder of TREDA, was my guru. I got trained in working for people with alcohol and drugs in this very TREDA center. And therefore, I consider it a great honor to receive an award in her name. She was a tremendous person who brought this whole de-addiction program. She, along with her elder sister, Joan Chungupura, actually in Kerala, and Sister Lily in Karnataka. These are the two people who brought de-addiction as a very medical, technical intervention for people with alcohol and drugs, which otherwise was considered as a behavioral problem, and so it can't be treated. But they said this is a medical problem, a social problem, and therefore it can be treated. And that is a change they brought in the whole understanding of dealing with addiction. And because of that, today, all over the country, trained people with them have started de-addiction centers, like the one I started in Belgaum, which is an 80-bedded center. And now we are starting one more in Goa, which is a 40-bedded center. So all across the country, we have numerous centers like this for treatment of alcohol and drugs, which brings a lot of peace and hope to the families of the people who are alcoholics and drug addicts. I wish to thank Father Shindo and the whole TREDA team. After Sister Lily left and Father Shindo has taken over, the whole team has been doing a tremendous job to rejuvenate the whole center, make it become more relevant to the issues of society, broadening the scope of its activities and work. And so today, TREDA has become a very good center for learning, a very good center for treatment, and a very good center for rehabilitation. Let's give a big round of applause to Father Shindo and the whole TREDA team. Since you have seen a photo of mine giving a TED talk, which maybe I'll share with them, you can hear it later. My whole concept of life is, the purpose of life is to be happy. What is life for? Life is to be happy. And what is the best way to find happiness? The best way to find happiness in life is to give happiness to somebody else. And this is what we have been trying to do for the last 35 years, founding 2 centers for de-addiction, 2 centers for HIV care, and I now live for the last 15 years in the Sumanahalli campus, along with people affected by leprosy, HIV, and disabilities. And this last 15 years has been the happiest years of my life. A lot of people say it's so difficult to work with leprosy affected, but I say it's so satisfying. So much of joy and happiness when you work with people like that. We went all the way to tsunami affected people in 2004. 2014, when the earthquake happened in Nepal, we traveled to Nepal. We were there for about 5 years. When 2009, the floods happened in Bellary, North Karnataka, we traveled there. 2018, floods in Kerala, we went to Wayanad. And COVID, we were all over the place, starting a program called Mother's Meal. So I found that finding happiness in life is by giving happiness to somebody else. Let's all be happy. Let's all create a happy world. Thank you so much.
Thank you, Father George, for these truly inspiring words. So we all learned a very new and inspiring definition of happiness. I hope we all remember it and spread happiness each day. We will now like to felicitate our reverend guests. I'll invite Ms. Yashpreet to announce the names so we can facilitate our guests. Thank you.
Well, it's only fair to honor our diligent guests in the light of contributions they've made to the society. So now I'd like to call upon Reverend Father Shinto Matthew and Dr. Lingaraju to do the need. We'd like to felicitate all our esteemed guests one by one. We'll start with Shri U.T. Kadir. Can we have a huge round of applause? Let's have the applauses coming as the guests are on stage. Can we have the applauses coming? We'd like to felicitate Shri Salim Ahmed. Can we have a huge round of applause as we felicitate Sir? Can we have the applauses coming? Let's please have the applauses coming as we do the deed. Now we'd like to felicitate Reverend Father Melvin. Can we please have a huge round of applause as we felicitate Father? My dear audiences, can we have louder claps? We'd now like to felicitate Shri Shaji George Thomas. Can we have a huge round of applause as we felicitate Sir? Please keep the applause coming. We'd now like to felicitate Reverend Father George Kannadanam. Can we please have you on the dais? All right.
Can we now felicitate Shri U.T. Zulfikar Ali? A round of applause, please. They have made significant contributions in the society. They deserve a huge round of applause. Next, we call upon Shri Jobin John. Next we have Can we kindly request Reverend Father Mark? Thank you. A big congratulations and thank you to all our dignitaries. Please take your seats. Thank you so much. Now we invite Shri Salim Ahmed to launch the toll-free number, which will have one single point of contact for TREDA in multiple languages for all TREDA services. So it will make it very easy for all the clients seeking help to approach TREDA through a toll-free number, which is available in multiple Indian languages. We'll do a brief demo here.
Welcome to TREDA, the Addiction and Counseling Center. Creating beautiful lives. Press 1. கன்னடக்காக 2 ஒத்தி தமிழுக்காக என் 3 அழுத்தவும் മലയാളത്തിനായി 4 അമർത്തുക Press 1 for counseling. Press 2 for de-addiction. Press 3 for training.
Actually, it will connect to our one of the agent. So today all our agents are busy. I don't know whether they will attend. If they attend, sir will talk to them.
Hello.
Hello.
Hello. Namaste. TREDA.
Good. Thank you. Thank you, sir.
We thank all our esteemed dignitaries for making time. Thank you. Thank you so much. We also thank our dear audiences. Thank you. It's time for the concluding sentence. With gratitude in our hearts and unity in our purpose, we conclude this memorable ceremony. Thank you everyone who's joined us in this momentous occasion.
May the glow of the lamp continue to illuminate our lives with wisdom, peace, and joy. And now we raise up for the national anthem.
For not going in. This is Bhavna Sharma.
This is Yashpreet Kaur.
Signing off for today.
Signing off for today.
Thank you all.
Thank you all.